Hello guys, so now we shall be discussing all the important concepts that are related with the head. Okay, so all the important topics in the head. So first important topic which we shall be discussing over here will be the landmarks of your skull. Okay, will be the skeletal landmarks of your skull. Skeletal landmarks of the skull. Skeletal landmarks of the skull. Coming to the skeletal landmarks of the skull, first of all, in this particular picture which you can see, what are the different kinds of bones which you can see over here? First of all, we'll discuss that. And then we shall discuss other different landmarks over here. First of all, this particular bone which you can see over here is named as your frontal bone. All of you know this is your frontal bone. This bone over here is called as your parietal bone. Parietal bone is best visualized from the top. Okay. Next, this particular bone over here is called as your temporal bone. And you see a bone on the back side over here. This is called as occipital bone. Occipital bone. So how many bones you have got over here? You have got the frontal bone, you have got the parietal bone, you have got the temporal bone and the occipital bone. And in the same way, you see a bone over here, right? This particular bone, right? So this particular bone over here is called as sphenoid bone. Okay, this bone over here is called as a sphenoid bone. So you can also appreciate one very important thing, that the frontal, parietal, temporal and sphenoid bone, all of them are meeting at this point, you see. So the point where all the frontal, parietal, temporal, occipital and the sphenoid bone, the point where all of them are meeting over here, right? So this particular point over here is called as pterion. What is this called as? This is called as a pterion. Now if there is a fracture of pterion, actually there is a middle meningeal veins, vessels, all of them are present behind this. Okay, I will tell what are the contents of the pterion later on, right? So but you have to remember that this pterion is a combination of all these bones: frontal, parietal, temporal, sphenoid, temporal, parietal and frontal. All these bones together form the pterion. That is another important question. Next important anatomical landmark after pterion, right? So it is pterion. Pterion. Next important anatomical landmark after pterion is, if you look at this, right? So you know that this is parietal bone, this is another parietal bone, this is your occipital bone. The suture which you can see between the two parietal bones over here, this is called as what? This is called as your sagittal suture. Sagittal suture. In the same way, the suture that is present between the occipital bone and the parietal bone, this suture over here is called as lambdoid suture. Okay, lambdoid suture. So where is the place where this sagittal suture and lambdoid suture, both of them are joining? That is the area number 4 over here. You see, this is the place where both the sagittal suture, right, and two lambdoid sutures, they are joining here. Right. So this particular area over here is called as lambda. So what is the area called as lambda? Lambda is nothing but the place where, or the junction of lambdoid and the sagittal suture fusing at that region is called as lambda. Now if you look at this, right, so this is your anterior part, this is your posterior part, right? You know that what is this particular suture over here? This particular suture over here is called as sagittal suture, and this particular suture which I am drawing right now with the red is called as coronal suture. Coronal suture. And what is this? Sagittal suture. So the place where sagittal suture and coronal suture are fusing exactly at this point. Okay, so this point over here is called as bregma. What is this called? This region is called as bregma. Okay, so what is bregma? Bregma is a place where both the sagittal and the coronal sutures are fusing. That is called as bregma. So far you have learned what? So far you have learned pterion, what is lambda, and you have learned what is bregma. Now look at this. What is vertex? The next important anatomical landmark is vertex, the highest point of the neurocranium. So this entirely is your neurocranium. The topmost part is exactly here. You see, this is the point. Okay, this is the topmost point, topmost elevated point. Okay, so this topmost point over here is called as vertex. So the superior part of neurocranium, okay, that is called vertex. For example, if I am putting all my fingers in this way, right, if I ask you what is the topmost area, this can't be topmost, this can't be topmost, so this is a topmost. In this finger, the middle finger over here is having the topmost point. This is called as a vertex. Okay, so that is a vertex there, which we were discussing right now. Okay, right. Next important anatomical landmark is that, see, you even have got a swelling in the frontal region. Yes, right, you see an anterior projection of the forehead. So this particular anterior projecting part of the forehead is called as glabella. This is called glabella. So what is your glabella? Glabella is nothing but the anterior projecting part of forehead, okay, anterior projecting part of forehead is called as glabella. Next important thing is that, where is pterion here? See, this is your pterion. All of you know that, right? This is your pterion. Okay. Now I am telling you that this is your frontal bone, sphenoid bone, temporal bone, and what is this? Parietal bone, and down here occipital bone. Now you see a point over here. This is a point where your parietal bone, your temporal bone, and occipital bone, all of them are fusing. This point where temporal, parietal, and occipital bone, all of them are fusing. This point over here is called as asterion. Okay, asterion. This point over here is called as asterion. Okay, now after this asterion, the next important point, this is from behind. Okay, this is from the posterior side. So on the posterior side, you see a point over here near the external occipital protuberance. So this prominent point of external occipital protuberance is called as inion. Okay, it is called as inion. What is inion? Inion is nothing but your prominent point of external occipital protuberance, okay, prominent point of external occipital protuberance is called as inion. Okay, next important thing here, you see this is the nose over here, right? And I can tell you that this is the root of the nose. The root of the nose is called as nasion. What is nasion? Nasion is nothing but the root of the nose. Just above that you have that swelling called as glabella. Okay, that swelling is called as glabella. So this is from outside, but if you look at the bony landmark, where is nasion present? First of all, you have to know that this colored part which you can see is called as a nasal bone. What is this? This is called as a nasal bone. Now in between two nasal bones, you see a line here. You see a line in between two nasal bones like this, right? So this particular line in between two nasal bones is called as internasal suture. What is this? This is called as internasal suture. This is called as internasal suture. Okay. Next important thing, what is this particular bone over here? This is your frontal bone. Okay, this is your frontal bone. Now between the frontal bone and between the nasal bone, and by the way, these bones over here, what did I tell you? These are called as your nasal bones, right? So this is called as your nasal bone. So between what? Between your frontal, okay, and between your nasal, you see a suture over here, right? So let me draw that suture here. You see this particular suture. Okay, so this suture is separating the frontal bone from the nasal bone. So this suture over here is called as frontonasal suture. Frontonasal suture. This suture is called as frontonasal suture. And this particular point over here is what is called as your nasion. This particular point over here is called as your nasion. So this is your nasion. Okay, frontonasal suture, internasal suture, and that point over there is called as your nasion. So these are some of the important bony landmarks which you need to know regarding the skull. So now we shall be discussing, after this bony landmarks, which the second topic which we shall be discussing is the pharyngeal arches. Okay, our topic of discussion would be regarding the pharyngeal arches. So what are the pharyngeal arches? Or pharyngeal arches are very important. Okay, so what are these pharyngeal arches? In the sense, there are around 5 arches. Okay, there are around 5 arches here. So all these arches, they develop into the structures that are related to the head and neck. It means some of the arches, they develop into, let us say, some cartilages, some muscles, right? Some of the cartilages develop into the ear, inner ear, middle ear, and so on and so forth. Okay, so what are these arches? We will discuss right now. Now, for first important thing is that, let us say, in the developing embryo, this is your head fold. Okay, this is your head fold, and all the way down, this is your tail fold. This is your head fold and tail fold. So this is a place where you have arches. This is a place where you have got these arches over here. So if you look at this particular picture, as I already told you, this part is called as your head fold. Okay, and this part over here is called as your tail fold. Okay, tail fold. And this part over here is called as your mouth. The mouth is also called as stomatium. So attached to the mouth, you have got arches. So these arches are nothing but called as your pharyngeal arches. If I remove these pharyngeal arches outside, how many pharyngeal arches I have got? So I have got 1, 2, 3, 4 and 5. How many pharyngeal arches I have got? I have got 5 pharyngeal arches. So pharyngeal arch number 1, 2, 3, 4 as well as 6. Okay, then where is the 5th arch over here? 5th arch is rudimentary. Okay, so where is the 5th arch? Yes, where is the 5th arch? The 5th arch is rudimentary. 5th arch is rudimentary. Okay, now what I'm telling you is that, for example, if I cut down these arches like this, okay, so all these arches, if I'm cutting down in this way, okay, actually these arches are in this way. I have drawn completely different. See, the arches are like this. For example, if I am cutting down the arches like this, and if you are looking in this particular direction, how does these look? See, these arches are not only on one side. Here I have got arch number 1, 2, 3, 4, 6. On the left side also I have got 1, 2, 3, 4, 6. On both the sides I have got. So this is a picture which I am showing from the side, right? But from the anterior view, this is how it looks. If I am cutting down all my fingers like this, right, you can see 5 arches on the right, 5 arches on the left. Like this, you can see the arches here. Okay, so how are these arches looking both on the right and the left? We will see now. Okay, first important thing is that, see, this particular structure is the first arch. You have got the second arch, third arch, fourth arch and sixth arch. Second, third, fourth and sixth arch. So how many arches are there? We have got 6 arches, and we have got 6 arches on both the sides. I told you, right? On both the sides we have got these arches. Now let me number them. So this is 1, this is 2, this is 3, this is 4 and 6. 1, 2, 3, 4 and 6. Okay, now another important thing is that there is an epithelium that is lining these arches. Okay, let us say the epithelium that is lining the arch from outside. You see, there is an epithelium that is lining the arch from outside. So this epithelium which is lining the arch from outside on both the sides, this is called as ectoderm. Any epithelium outside, you call it as what? Ectoderm. In the same way, there is an epithelium that is lining the inner surface of the arch. So if an epithelium is lining the inside or the inner surface of the arch, you call this as endoderm. What is this? This is called as your endoderm. This is your endoderm. And then what is the epithelium that you have in the center of the arch? In the center of the arch, the epithelium which you have is mesoderm. So there are 3 different germ layers, right? There are 3 different layers over here. One is called as ectoderm, another one is mesoderm, yes, and the other one is called as your endoderm. So these are the 3 germ layers that are present over here. Now important thing is that you can see some depressions. right? You see very clearly, you can see some depressions on the outside, you can see depressions on the inside. Depressions which are present on the outside, right, these are called as clefts. What are the depressions that are present on the outside? These are called as clefts. Then what are the depressions that are present from inside? These are called as pouches. Okay, these are called as pouches. So what are the so can I tell like this, that clefts are lined by which epithelium? Clefts are lined by ectoderm. Where are pouches are lined by? Pouches are lined by endoderm. So this is an important thing you have to know, that the clefts are lined by ectoderm. Clefts are lined by ectoderm. Pouches are lined by endoderm. Pouches are lined by endoderm. Okay, this is one of the very important thing you have to keep in your mind. Okay, now next important thing, what is the next important thing you have to see is that what are the structures that are developed out of these clefts as well as pouches. Okay, so first what we will discuss is that we shall discuss what are the structures that are developed from clefts, then we shall discuss what are the structures that are developed from pouches, then lastly we will discuss what are the structures that are developed from the arches. Okay, so let me draw that picture once again. So these are your pharyngeal arches. Okay, first important thing you need to know is that you know now that this is your first cleft, this is your second cleft, this is your third cleft, this is your fourth cleft. What are all this? These are all called as clefts. Inside what do you have? You have got pouches. Now what will happen is that in the first step, what is going to happen is that look at the first cleft. The first cleft is already depressed, है ना? First cleft is already depressed, but what is going to happen is that this first cleft will undergo invagination in this way. You see, the first cleft is undergoing invagination like this on both the sides. On both the sides, what is going to happen? The first cleft will undergo invagination process in this particular manner. So this is how they are invaginating. Done. Now coming to the pouch. What are the pouches over here? So these are the pouches. Okay, so let us say this is the first pouch, second pouch, third pouch and fourth pouch. Now look at the first pouch. What is happening? The first pouch is also undergoing invagination inside. Okay, you see the first pouch is also undergoing invagination in this way. Here also the first pouch is undergoing invagination in this way, like this. Okay, now right, let us see what is happening with the first cleft over here. Okay, so let us see what is happening with the first cleft. Now the first cleft, if you look here carefully, the first cleft will undergo invagination in this way. You see how it underwent invagination? In the same way, the first cleft on the opposite side also will undergo invagination this way. Okay, the first cleft on the opposite side also will undergo invagination in this way, like this. So there is invagination on both the sides. Now coming to first pouch, as I already told you, the structures which are present over here are called as pouches, right? Just number wise, 1, 2, we have got 3 and 4. Okay, now if you look at these pouches, even pouches also invaginate inside like this. Here also the pouch is invaginating inside. Now what is happening? The first cleft and the first pouch, they touch each other. So when the first cleft and the first pouch, when they both are touching each other like this, the point where they are touching here, this is forming a specific structure. I will tell you what is this. Now remember here that this particular structure over here, later on, you know, how does it develop? This particular structure is like this, right? This particular structure is like this, isn't it? Right? Later on it will develop slowly like this, and later on finally it will take the shape of an ear. This is the ear. You see, this is the ear pinna. Now you see how the ear pinna is formed. Ear pinna is formed from the first cleft over here. Okay, now once ear pinna is formed, what did I tell you over here? I told you that here you have got ear pinna, and what is this particular segment? This is called as external auditory canal. Okay, Now you should also have middle ear and internal ear. So who is forming this middle ear and internal ear? They are formed with the first pouch. So what is happening? The first pouch will invaginate deep inside and join with the external artery meatus. Now after joining, this place where they are joining, this part will become the tympanic membrane, and slowly a septum is developed here. Now look here, what are the structures that are formed? See, this is your external ear, right? This is your tympanic membrane. Here you have got this particular part is called as a middle ear, and this part over here is called as the inner ear. What is this called? This part over here is called as the inner ear. So can I tell you like this, that external ear pinna, right, or external artery meatus, they are developed from the first cleft, and middle ear, inner ear, and all these structures are developed from first pouch. Yes or no? So they are developed from first pouch. So let us write down what are the structures that are developed from first cleft over here, and what are the structures that are developed from first pouch over here. Okay. So first cleft develops into ear pinna, and external auditory meatus, ear pinna and external auditory meatus. If you look at first pouch develops into what? Tympanic membrane. It develops into middle ear, right? It develops into middle ear cavity, and remember thing, it also develops into eustachian tube. Okay, it also develops into eustachian tube. So I hope now you understood how this first pouch and first cleft are formed. So all these are located here. Okay, this thumb finger is representing the first pouch. Thumb is exactly touching my ear. It means the first pouch and the first cleft here, they are forming what? They are forming the ear and all these regions over here. Okay. Now next important thing, coming to the second, third and the fourth cleft. Look what is happening with the second, third and the fourth cleft. So this second, third and the fourth cleft, this will also undergo invagination in a different way. So this is how they are undergoing invagination. Just look here. See, they come down all the way like this, and they undergo invagination this way. Second, third and fourth. Okay, you see on both the sides. What is happening? The second, third and the fourth, they undergo invagination in this way. Second, third and fourth, they undergo invagination in this particular manner. Second, third and fourth. Here also second, third and fourth. This is how they undergo invagination. Okay. Now what is happening because of this invagination? That is very, very, very important to know. Okay. So what is happening because of this particular invagination? Now because of this particular invagination, all of you just look here. This is your second, this is your third, this is your fourth. Okay, this is your second, third and fourth. Now this will later on form what? This will later on form a sinus called as cervical sinus. Okay, now what will happen? This cervical sinus will later be obliterated in the sense this cervical sinus will be disappeared. For example, if this cervical sinus is not obliterated, then what will happen? This cervical sinus will convert in this manner, 2, 3 and 4, like this, 2, 3 and 4. This particular structure, what it has been converted into is called as branchial cyst. What is this called? This is called as branchial cyst. Okay, so first whatever it is formed is a cervical sinus. Cervical sinus will be obliterated, it will be disappeared. If it is not disappeared, that would lead to formation of a branchial cyst. So you can see a small cyst in this child over here in the neck region. This is the unobliterated, I mean the cervical sinus which has not been obliterated. So this is your branchial cyst over here. Okay, so this is the branchial cyst. So I hope we are done with all the clefts. 1, 2, 3, 4, all of them are done. Now let us discuss about the pouches. Okay, how are these pouches invaginating? We will discuss. We discussed already about the first pouch. You know the first pouch will develop into tympanic membrane, middle ear and eustachian tube. Okay, now we will discuss about the second pouch. Now what is happening over here, what is happening with the second pouch over here is that within this second pouch, this second pouch will invaginate a little deeper, not more, little deeper like this. Okay, within this second pouch there is a structure that is formed. This structure is called as tonsils. Okay, so tonsils are formed by which pouch? Tonsils are formed by your second pouch. Okay, so let me write down over here that the second pouch will take part in the formation of tonsils, Now once the tonsils are formed by the second pouch, look at the third pouch over here. Now what will happen with the third pouch is that this third pouch will divide into two wings like this. You see here also I am drawing this. Third pouch will divide into 1 and 2. It will divide into two wings. Even the fourth pouch is also dividing into two wings. So here also it is dividing into 1 and 2. Here also it is dividing into 1 and 2 wings like this. Okay, what are these wings which it is dividing into? So it is dividing into two wings. One wing is called as a dorsal wing. See, this wing is called as dorsal wing, and this wing over here is called as ventral wing. One is called as dorsal wing, another one is called as your ventral wing. Now what structures are formed over here? Is that in the dorsal wing, in the third pouch, in the dorsal wing, a gland is formed over here. Now these two glands over here, along with that there is another gland also that is formed down over here. Okay, so this gland which I have drawn with the let us say this color, the pink color over here, this gland over here is called as your thymus. What is this? This is called as your thymus. Okay, and this particular gland over here is called as parathyroid gland. What is this? This is your parathyroid gland. Where is your thyroid gland, by the way? Your thyroid gland will be situated in the center. Let us say, look here, this is your thyroid gland like this. You see, this is your thyroid gland and this is your parathyroid gland over here. After that, down here also in the dorsal wing of the fourth pouch, here also you will see a parathyroid gland. Now tell me, which is superior parathyroid gland, which is inferior parathyroid gland? Now don't get confused. The top one is not superior. Top one is inferior parathyroid gland. This bottom one is the superior parathyroid gland. So what is going to happen? The inferior parathyroid gland will travel all the way down inferiorly, crisscross in this way. You see, it is traveling all the way down inferiorly like this, right? And the superior parathyroid gland will travel all the way superiorly in this way, crisscross. Okay, clear all of you? Right. So now let us write down all the structures over here. Let us write down the structures that are developing from the third pouch and from the fourth pouch. Now in the third pouch I have discussed that there are two wings. One is called as the dorsal wing. Another one over here is called as your ventral wing. Okay, so the same thing you have in the fourth pouch also. You have got the dorsal wing, and the next one over here is called as your ventral wing. Dorsal wing as well as your ventral wing. Okay, now what did I tell you? Dorsal wing over here, third pouch dorsal wing. Third pouch dorsal wing will develop into inferior parathyroid gland. Ventral wing will develop into thymus. And dorsal wing of fourth pouch will develop into superior parathyroid gland. Okay, so these are the important pouches, whatever you see, pouches or clefts which you can see over here. Okay, now there is one very important clinical condition. What is this clinical condition is that all of you know that, let us say that this is a chromosome. Okay, so this particular chromosome is basically having a long arm like this, a long arm as well as a short arm. right? Now long arm is called as P, short arm is called as Q. Now in this Q at the 11th position, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 and 11. See this particular position which I am highlighting with the green is the 11th position. So there is a deletion at this 11th position and this is a chromosome number 22. So how will you write this down? You will write this chromosomal abnormality as 22. There is a problem in the Q, exactly which segment? 11th position. Problem in the Q, exactly 11th position. There is a deletion. There is a deletion of that particular gene there. Okay, so this particular condition is called as Dye-George syndrome. What is this condition called as? Dye-George syndrome. So what is happening because of this Dye-George syndrome? Because of this Dye-George syndrome, there is a defect in the development of, what development will stop? Pouch 3 and pouch 4. Pouch 3 and pouch 4, these structures, they do not develop. They do not develop. Okay, pouch 3 and pouch 4, they do not develop over here. So when pouch 3 and pouch 4 do not develop, parathyroid glands are not produced, thymus is not produced. So what will happen in the patient? What will happen in the patient is that there will be absence of parathyroid glands as well as thymus. So this absence of parathyroid gland as well as thymus is called as your Dye-George syndrome. I hope you understood whatever I am trying to teach you. So in this way, we have discussed about all the clefts, we have discussed about all the pouches, right? So how many clefts? 4 clefts. How many pouches? 4 pouches. So what is coming from the first cleft, first pouch, you know. What is coming from the second, third and fourth also, you know now. Okay. Now coming to the next important thing, that we'll discuss about the arches, about each and every arch. First, what we shall discuss is that we shall discuss what are the structures that are derived from these arches. Okay, we shall first discuss what are the structures that are derived from these arches. Structures in the sense like what cartilages, what muscles does it have. Later on, from each arch, what artery is supplying here. In each arch, what nerve is innervated over here also we'll discuss. Okay, so first you can see over here that these are all the arches. For example, this is the first arch over here. The blue color one is called as, this one is called as your second arch. This yellow one is called as your third arch. This one over here is called as the fourth arch. And this one over here is called as the sixth arch. How many arches are there? 6 arches are there. Now you will tell me, first arch is developed into what all structures? What all you can see over here? See, first important thing is that you have to know one cartilage called as Meckel's cartilage. So first cartilage is Meckel's cartilage. Later on, this particular Meckel's cartilage will develop into a specific structure called as mandible. Okay, now all of you know, you see this mandible over here, this is a mandible. Okay, after that you will have 2 important bones. What are those 2 important ear ossicles over here? See, what is this one and this one? One is called as malleus, another one is called as incus. One is called as malleus and the other one is called as your incus. So all M's, okay, M for Meckel's cartilage, M for mandible, M for malleus and I for incus. So majority you have got the M's. All these M's here are derived from what? They are derived from the first arch. They are derived from the first arch. After this, the next important thing is the second arch. What are the structures that are derived from the second arch? What is the first letter in second? S, right? So S stands for what? What is the remaining bone here? Stapes. Remaining bone here is called as stapes. After stapes, you see what is this particular process? What is this particular process over here? This is called as styloid process. This is called as styloid process. Okay. Next, after that, after styloid process, you know what is this ligament that is connecting styloid process? See, this is your styloid process, right? And this is your hyoid bone. Okay, now in this hyoid bone also, you have got 2 horns. See, this horn is called as a greater horn of hyoid bone. This is called as a lesser horn of hyoid bone. So this from the styloid bone, you see a ligament that is going and attaching to the lesser horn of hyoid bone. This is called stylohyoid ligament. What ligament is this? Stylohyoid ligament. This is called stylohyoid ligament. Okay, stylohyoid ligament. Next, after stylohyoid ligament, the muscles The muscle that is attached to the stapes is stapedius muscle. Stapedius muscle. Clear? And finally another important thing, that is your facial muscles. Facial muscles. So all these are with the S. Majority of them, or almost all of them except one, with the S. S for second arch. All of them are derived from the second arch. Now coming to this particular part over here, what is a third arch derived into? Third arch is having what? A greater horn. The second arch is having lesser horn. So this will have greater horn of hyoid. What is this? Greater horn of hyoid bone. Okay. After greater horn of hyoid bone, remember only one thing, that is stylopharyngeus muscle. Stylopharyngeus muscle. These are the structures that are derived from the third arch. Now coming to the fourth as well as the sixth, these two arches, the fourth as well as the sixth, these two arches, they develop into a specific structures. All the cartilages you can remember by the mnemonic CATE, CATE. Okay. Now with the help of, with C, what is a cartilage with the letter C? That is your cricoid. Okay. Another C is cuneiform. C is cricoid, C is cuneiform. Next C is corniculate. Okay. After that, next you have got what? A. What does A stands for? Arytenoids. Next T stands for your thyroid, and E stands for your epiglottis. So all these cartilages, whether they are paid or unpaid, we will discuss later. So all these cartilages are derived from fourth to sixth arch over here. So these are all the structures that are derived from these arches. Okay. So now we shall discuss that in each arch what is the artery and what is the innervation. Okay. So what is the artery and innervation in each arch? First let us discuss about the first arch. In the first arch, what is the artery that is supplying? That is your maxillary artery. Maxillary artery is the artery that is supplying your first arch. Okay. Next, coming to the second arch. Let me also write down the remaining arches also. The second arch and the third arch. Okay. I'll write the remaining. So coming to the second arch, the artery which we have over here is stapedial artery. Stapedial artery. Coming to the third arch, it is common carotid artery and the first part of internal carotid artery. First part of internal carotid artery. Okay, so these are the nerves over here. And by the way, from the fourth arch, what is derived? From the fourth arch, you have got arch of aorta. What is that? You have got arch of aorta. So these are some of the important arteries which are previously asked in the exams. These were the important arteries which are asked from these respective arches. Okay, so arch of aorta. Arch of aorta is derived from your fourth arch. Now when it comes to the nerves, okay, so what are the nerves which you have over here? For example, first arch, if you look at the first arch, you have got the trigeminal nerve, that is V3. Okay, so that is V3 branch of trigeminal nerve. Okay, coming to the second, you have got the seventh cranial nerve, and coming to the third, you have got the ninth cranial nerve. So these are the branches which you see. These are the nerve innervation which you see over here. Okay, so this completes the pharyngeal arches. So the first arch is, within the first arch we have got the maxillary artery, next stapedial artery, common carotid artery, and the first part of internal carotid artery. Now coming to the fourth arch, fourth to sixth arch, right? So together we discuss, but here in case we will discuss the fourth arch separately. Actually cartilages are formed together. Okay, from fourth to sixth arch, cartilages are formed together. Okay, now coming to the fourth arch, right? In the fourth arch, fourth arch is divided into what arteries? One is called as your right subclavian artery. What is that? That is divided into right subclavian artery. Right subclavian artery. Okay. Another one you have to remember is aortic arch. The left side of the aortic arch. If the arch of aorta is there, that is divided into right and left. That is the left aortic arch. Left aortic arch. Okay. When it comes to the sixth arch, what is sixth arch developed into? Okay, what is sixth arch developed into? You have got pulmonary artery dividing into right and left pulmonary artery. You have got pulmonary trunk like this dividing into right pulmonary artery as well as left pulmonary artery. Okay, so here this is called as your right pulmonary artery, and this is called as your left pulmonary artery, both of them, right and left pulmonary artery. And not only that, even ductus arteriosus. All of you know what is ductus arteriosus, right? So even ductus arteriosus also is derived from the sixth arch. When it is coming to the nerve supply, so already we discussed that trigeminal nerve for first arch, seventh for second arch, ninth for third arch. Now coming to the fourth arch, which cranial nerve? 10th cranial nerve. What is that cranial nerve? 10th cranial nerve. Then sixth arch again it is 10th cranial nerve. But the branches are different. When it is coming to the fourth arch, the cranial nerve over here is 10th, and 10th cranial nerve gives out a branch called as superior laryngeal nerve. That is your superior laryngeal nerve. And remember one thing, that this superior laryngeal nerve will control the muscles that are responsible for swallowing. In the same way, coming to this particular 10th cranial nerve, which is derived from the 6th arch over here, right? So it will give off a branch called as a recurrent laryngeal nerve. All of you know recurrent laryngeal nerve except cricothyroid muscle, it innervates remaining all muscles, right? Which is responsible for speaking. So this is one of the very important thing which you have to understand over here. So this completes the complete discussion of your arches. Okay, so these are as this is a rapid revision session, so I have discussed only the important points which you need to know regarding these arches over here. So guys, now we shall be discussing regarding the development of the tongue. Okay, development of your tongue. So we shall discuss the topic of development of the tongue, which is very important. Okay, so when is the tongue developed? The tongue development happens during the 4th week of intrauterine life. Okay, so how is this tongue developed? So you already know what are the different kinds of pharyngeal arches. Okay, so now what I am doing is that I will draw these pharyngeal arches over here, and then I will explain you how the tongue is developed from that. So let us say this is your first pharyngeal arch over here, second, we have got third, we have got fourth. Okay, I'm not drawing all the arches, right? So these are the arches over here. Okay, so let us say the pharyngeal arches are on both the sides, I told you, right? So these are the pharyngeal arches that are present on both the sides. Okay, so if this is the midline over here, yeah, so these are the arches on both the sides. Now if you look here, in the first arch, so this is your first, this is your second, this is your third and fourth. Actually 6 you have to draw, but I'm just drawing 4. Okay, now coming to the first arch, near the first arch there are 2 swellings over here. Okay, these swellings over here are called as lingual swellings. What are these swellings over here? These swellings over here are called as lingual swellings. Where are these lingual swellings located? Only one? No, 2. Laterally. They are located laterally. Lingual swellings are located laterally. Okay. Now in the center of a lingual swelling, you have got a body here. This is called as a tuberculum. Okay, there is only one tuberculum, so impaired, right? Paid or impaired? Impaired. That is why you called as impar. What is the complete name? Tuberculum impar. So what is the name of this particular tuberculum? You call it as tuberculum impar. Why are you calling it as impar? Because there is only one tuberculum over here. Okay, now just beneath this tubercle, you have got one more structure over here. Okay, so this particular structure which is located just beneath that particular tuberculum over here, you call it as, so just beneath the tuberculum you see a red color structure. This structure is called as thyroid primordium. What do you call this as? You call this as thyroid Thyroid primordium. What do you call this? You call this as thyroid primordium. Just beneath the thyroid primordium, covering your second, third and fourth arch like this, okay, mainly third and fourth arch covering your primordium, you see a structure over here. This structure is called as copula, okay, but the other name for this is hypobranchial eminence. So what is this structure called as? This structure is called as copula or hypobranchial eminence. Copula, or you can call it as hypobranchial eminence. So this is one structure over here, this is another structure over here, and here you have got a third structure called as copula or hypobranchial eminence. Okay, copula or hypobranchial eminence. Now how is tongue developed from these structures? So first of all, what we will do is that we shall discuss about these things later on, but one very important thing I want to tell you over here is about this thyroid primordium. You know, this dense tissue of thyroid primordium, whatever is there, what will happen to this is that this particular thyroid, I will discuss about it later on in much detail, okay, but for now I just want to tell you here that this thyroid primordium, within this thyroid primordium you see a small depression, okay, so this will undergo depression in this way. Okay, now this depression will elongate down like this. You see, this depression is elongating down and forming a duct, right? This particular duct is called as thyroglossal duct. What is this? This is called as thyroglossal duct. All the way from the thyroid gland to the tongue, there is a duct here. This is thyroglossal duct. Basically, before birth, just before birth, this will disappear. Okay, but sometimes what will happen is that even after birth also it doesn't disappear. That will result in the formation of a cyst. That thing I will discuss when I will discuss about the development of your thyroid gland. Okay, but for now what I am telling you is that you should know what is this thyroid primordium. Okay, right. Next important thing, how is a tongue formed over here? Now all of you know that if you look at the tongue like this, right, so this is a tongue. Now in this tongue, what are the important regions you have got over here? See, this part of the tongue is your anterior 2/3 of the tongue. Okay, this is called as a posterior 1/3 of the tongue. Okay, and finally this part is called as a posterior most part of the tongue. This is your posterior most region of the tongue. Okay, so how these three regions are formed and which region is formed first? First important thing is that I just told you, you have got two lateral swellings, right? These are called as lingual swellings. So how many lingual swellings are there? Two. See, there is one lingual swelling over here. There is another lingual swelling over here. There are two lingual swellings. And down to the lingual swelling, you have got a body here. What is this body called as? I told you this is called as your thyroid primordium. What will happen is that this lingual swelling on the right, on the left, okay, these lingual swellings, they fuse with each other along with this body also fuses with each other. So all these three things together, they will fuse with each other. Now when all these three things together will fuse with each other, all these three things will result in the formation of this particular structure like this. Okay, what is this particular structure over here? This particular structure is nothing but called as your anterior 2/3 of your tongue. Okay, what it is forming? Anterior 2/3 of your tongue. Now if I ask you anterior 2/3 of the tongue is formed by, you have to tell right lingual swelling, left lingual swelling, as well as thyroid eminence, right? Thyroid primordium. Okay. After that, down here, what do you have is called as copula, right? Copula, or you can call it as hypobranchial eminence. So let us bring that thing here. So this particular structure over here is called as your copula or hypobranchial eminence. Now I am dividing this copula or hypobranchial eminence into two structures. So this part which is on the top is called as a cranial part, and this part which is on the bottom is called as a caudal part. Okay, how many parts do we have over here? So this particular part over here is called as a cranial part, and this part is called as the caudal part. Cranial and caudal. What does cranial part do? Already anterior 2/3 of the tongue is done, right? See, this is done. 2/3 is finished. Now leftover is posterior 1/3. So cranial part forms the posterior 1/3 of the tongue. Posterior 1/3 of the tongue. Okay, and what does this caudal part too, the caudal part will form the posterior most part of the tongue, posterior most part of your tongue. So all of you now understood that anterior 2/3 is formed by right and left lateral swelling, lingual swelling, along with this thyroid, what is this, primordium. Posterior 1/3 is formed by the cranial part of hypobranchial eminence, and posterior most is formed by the caudal part of the hypobranchial eminence. Okay, now let us look at the derivatives. Let us look at the arches overall in a summary. Lingual swellings. When I tell lingual swellings, tell me from where these lingual swellings are formed, from which arches. Tell me which arches these lingual swellings are present. Look at the picture. They are present in the first arch. Okay, lingual swellings are present in the first arch. Okay, after lingual swellings, we have got tuberculum impar. We have got tuberculum impar. So tell me, where is this tuberculum impar exactly located? This tuberculum impar is this one, right? This one. So this is located in the first and second arch, right? So somewhere in the first and second arch. So it is located both in the first and second arch, first and second arch. Next, where is this hypobranchial eminence located? Hypobranchial eminence. Where is this hypobranchial eminence located? That is located all the way in the second arch, third arch, as well as the fourth arch. Okay, so second and third we have got the cranial part, and fourth we have got the caudal part. Okay, so these are some of the important points which you need to know regarding the development of the tongue. So now we shall be discussing regarding the development of your thyroid gland. Development of the thyroid gland. Now regarding the development of the thyroid gland, once if you understood the development of the tongue, development of the thyroid gland is easy. Remember one thing, that this development of the thyroid gland is developed from the pouches. So all of you know that the pouches are lined by what? Pouches are lined by endoderm. So that is why this thyroid gland is endodermal origin. Thyroid gland is your endodermal origin. Okay, right. Next important thing is that when does this development of thyroid gland development start? Basically it begins on 24th day. So it begins on 24th day. Now after, when it begins on 24th day, from when the thyroid gland start functioning, it starts functioning from the 12th week. From the 12th week it starts functioning. From the 12th week. Okay, now another important thing is that you remember that the picture which I have drawn just before, right? So what was that? Here I have drawn, I'm just drawing it roughly now. Here I've drawn some arches like this, right? I've drawn some arches, and I've told you that here you have got two swellings. What are these? Right and left lingual swelling, right? Below this lingual swelling I have got what? This is called as tuberculum impar. Beneath the tuberculum impar I have got another body over here. What is this called as? This is called as thyroid primordium, right? So this body over here is called as your thyroid primordium. Okay, now what is happening with this thyroid primordium? All of you look here. This is your thyroid primordium. So what will happen is that this thyroid primordium will invaginate inside, right? So there is a small depression that is developed within this thyroid primordium like this. Okay, there is a small depression within this thyroid primordium. You see the depression over here. Now this depression will invaginate more and it will form a duct in this way. So this depression will invaginate more down like this, you see, and it is forming a duct. This depression will invaginate more like this and it forms a duct in this way. Okay, so this particular duct which is formed, actually it starts all the way from your tongue and down all the way to the thyroid gland. So that is why this particular duct over here is called as your thyroglossal duct. Okay, what is this thyroglossal duct? And this thyroglossal duct is having an opening over here. This opening is called as foramen cecum. What is this called as? Foramen cecum. Where is the foramen cecum located? On the base of your tongue. It is located on the base of your tongue. Okay, on the complete posterior side of your tongue. Clear? Now what is going to happen? What is going to happen is that, see, all of you just look here. Let me draw just a small picture. All of you know that here you have got your hyoid bone like this. This is your hyoid, and down to the hyoid you have got this particular bone. What is this? Cartilage called as thyroid cartilage. And below this you have got your cricoid cartilage, and all these are your tracheal rings like this. So all these are your tracheal rings. So in this way you have got tracheal rings. Okay. Now you know that here you have got your tongue. This is the tongue. Okay, so completely on the back of the tongue here you have got a small opening called as foramen cecum, which I just told you. This is called as foramen cecum. Now what is happening with this foramen cecum is that from this foramen cecum you see a duct that is coming all the way down till the place where the thyroid gland used to be there. Okay, so it is having a duct. Now what is going to happen? What is going to happen is that this is called as a tip of the duct. You see, this part is called as a tip of the duct. Now this tip of the duct, what will happen to this tip of the duct? Look here. This particular tip of the duct will bifurcate into two structures. See, this is foramen cecum and this is a duct. The tip of the duct is bifurcating into two structures like this. Okay. So what will happen is that at the end of 7th week, at the 7th week end, okay, at the end of 7th week, what will happen is that the cells that are present over these bifurcated part of thyroglossal duct, whatever is there, these cells, they start to multiply. So they start to multiply like this. They multiply in this way, and now you know they are forming slowly the right lobe of the thyroid. Here also they start multiplying like this. The cells here multiply and they start forming the left lobe of your thyroid, and here also there are cells, even they start multiplying like this. They start multiplying like this and form the isthmus of the thyroid gland. So overall your thyroid gland with two lobes and the isthmus, third lobe, is formed completely. Okay, so here slowly what is happening, that is how the development takes place, and finally you see the thyroid gland that is formed over here. Now once the thyroid gland is formed, just before the birth, what will happen? This particular thyroglossal cyst will disappear. Thyroglossal cyst disappears before birth. For example, if the thyroglossal cyst did not disappear before birth, what is going to happen? What is going to happen is that sometimes there is a chance that within this duct there is a cyst that is formed like this. This particular cyst is called as thyroglossal cyst. This particular cyst is called as thyroglossal cyst. Okay, so when there is thyroglossal cyst, you will see a swelling in the anterior part of the neck. Usually this is asymptomatic. Only when it gets infected it becomes symptomatic. Okay, so this particular thing over here is your thyroglossal cyst. And you know how do you examine this thyroglossal cyst? When you protrude the tongue outside, this cyst moves. Okay, if the cyst is moving up when you protrude the tongue outside, right? So that is your thyroglossal cyst over here. Clear? So this is your thyroglossal cyst, and this is how the development of your thyroid gland happens. So now we shall be discussing different parts of the skull. Okay, so the first part which we shall be focusing is the norma frontalis. Norma frontalis is the first important part. Anyways, we shall not be going into detail about each and every part. Only those parts which are really very important for your exams we shall be discussing. Okay, the remaining things we shall just superficially touch over these things. Okay, now when it comes to norma frontalis, whatever you can see from the front is called frontalis. right? So norma frontalis is first of all formed by how many bones? So first bone which you can see over here, let us discuss in complete detail with many pictures. So this particular bone over here is called as your frontal bone. Okay, norma frontalis is formed by frontal bone over here. And next, so if this is your frontal bone over here, you can see what is this particular bone. This particular bone over here is your orbital bone. Okay, so what is this? This is your orbital bone. Okay, now after these orbits are done, can you, if I zoom in, can you just see a line over, a suture over here, right? Can you see this particular bone? Yes or no? You see this particular half all the way. Yeah, you see this, right? Again, I'm drawing this on another bone over here. See, from here all the way, you see this bone. So this particular bone which I'm drawing right now, which is present on both the sides, right? This is called as maxillae. What is this called? This particular bone over here is called as maxillae. So norma frontalis is formed by frontal bone. Next we have got two orbits. Next we have got two maxillae. Okay, along with these two maxillae, you even have got one more important thing. Okay, so what is that another important thing along with this maxilla over here? See here, if this part over here is called as maxillae. Okay, so I'm just drawing the dotted lines. You see this part over here is called as your maxillae, right? If this part over here is called as your maxillae, just side to that maxillae, you have got another part, you see. You see this part? This part over here, you see this part over here is called as your zygomatic or cheekbone. What is this? Zygomatic bone or cheekbone. Okay, and next important bone over here is this part over here is called as your mandible. This is your mandible. This is your mandible. This part over here is called as your zygomatic bone. Zygomatic, or you call it as cheekbone. Zygomatic or cheekbone. Okay, next important thing is that you can also see a bone over here. Actually this is not a single bone, there are actually two bones over here. Okay, so what are these two bones? This is called as a right nasal, this is called as a left nasal. So whatever it is, both of them together you call it as the nasal bones. Together you call it as a nasal bones. Okay, so if I ask you what are the structures that form norma frontalis, what are the structures that form norma frontalis? You have got the frontal bone over here. Okay, next you have got the two nasal bones. Third important thing is you have got the maxilla. How many maxillae are there? There are two maxillae over here. Next, how many nasal bones we discussed? How many zygomatic, right? On both the sides you have got the zygomatic bone or cheekbone. How many are there? Two. Zygomatics are two. And how many mandibles are there? One. How many mandibles are there? One. So all these structures together, they form norma frontalis. What are they form? They form what? Norma frontalis. Next important thing after this norma frontalis is that how many apertures do you have here? In the frontal region, how many openings can you see? So exactly here I can see three openings. See here, two openings for two orbits, and next an opening I can see in the nose. How many openings are there? Three openings are there. Okay, so what you have to write here, how many apertures are there here? How many apertures? So basically we have got three apertures. What are those three apertures? Two apertures are for orbits, two orbits, and one aperture is present in the front. This is called as anterior nasal aperture. The aperture of the nose, anterior nasal aperture. So in this way there are apertures over here. Next important thing, if you first let us discuss about the orbits. Okay, first we will discuss about the orbits, later we will discuss about the anterior nasal aperture over here. Now regarding these orbits, what is the important thing you can see is that if I zoom in, right, see orbits are having four important walls. It is something like a quadrangular, not perfectly circular. Four important walls. See here, this particular wall of the orbit is called as supraorbital margin. Okay, this part is called as infraorbital margin. In the same way, this part is called as lateral orbital margin. This is called as medial orbital margin. So how many orbital margins do we have? We have basically have got 4 important margins. See, this is called as what? Supraorbital margin. This is called as supraorbital margin. Next, this one over here is called as infraorbital margin. This one over here is called as medial orbital margin, and this one is called as a lateral orbital margin. So how many orbital margins we have got? We have got 4 orbital margins. First, let us discuss about supraorbital margin. Okay, if you look at this supraorbital margin, if you look at this this entirely is your supraorbital margin. Now look here carefully. Again I am drawing. See, this I am drawing with the dotted lines. This entirely is your supraorbital margin. Now this entire supraorbital margin, I am dividing it into 2 halves like this. Okay, what are these 2 halves? This is called as the lateral 2/3. This is called as a lateral 2/3, and this is called as the medial 1/3. Okay, what are the 2 halves? Lateral 2/3 and medial 1/3. The junction of lateral 2/3 and medial 1/3. Let me use another color. Yeah, the junction between lateral 2/3 and medial 1/3. You see a small fossa over here. Exactly here you see a small fossa. This is called as supraorbital foramen. This is called as what? Supraorbital foramen. Okay, what are the structures that are passing in the supraorbital foramen? Supraorbital artery, supraorbital vein, and supraorbital nerve. So here you have got supraorbital artery, supraorbital vein, and supraorbital nerve. Okay, these are the 3 structures that are passing. See here also you have got, and here also you have got supraorbital foramen. Where it is present? It is present in the lateral 2/3, junction between the lateral 2/3 and medial 1/3 of supraorbital margin. Okay, right. Next important thing is that if you focus on the infraorbital margin, okay, if you focus on the infraorbital margin, what are the important things you can see? See, this entirely is your infraorbital margin. You see, from here all the way I am drawing the dotted lines. This entirely is your infraorbital margin. If you carefully look at the infraorbital margin, here infraorbital margin is formed by 2 bones. So how am I highlighting? See, from here all the way till here there is 1 bone, right? And from here all the way till here you have got another bone. Okay, so what are these 2 bones? If you can see here, this particular bone is A, this particular bone is B. What is A over here? A is present laterally, B is present medially. Yes or no? So laterally, what is the bone do you have? You have got the zygomatic bone. Zygomatic bone. And medially what do you have? Medially what bone do you have? You have got the maxilla. You have got the maxilla, right? So both of them together, what are they forming? Both of them together, they form the infraorbital margin. And in the center of infraorbital margin, you see a suture. You see, there is a suture in front, in the middle, in the center of infraorbital margin. So this suture is present between zygomatic and maxilla. I am calling it as maxillozygomatic suture. What is this? Maxillozygomatic suture. So what is this suture by name? This suture is called as maxillozygomatic suture. In the same way, we are done with superior inferior. Now look at the medial wall. If you look at the medial wall, where is the medial wall present? See, all the way, this entirely is your medial wall. Okay, this entirely is your medial wall. Now in this medial wall, this part of the medial wall is the superior part of the medial wall, and this part of the medial wall is the inferior part of the medial wall. Now medial wall is also made up of 2 important bones. What are those 2 important bones? See here. This superior part of the medial wall, this particular superior part of the medial wall is made up of frontal bone. Yes or no? Just look at the picture. It is made up of frontal bone. And what is this particular one made up of? This is made up of maxilla. You see, this is made up of what? Maxillary bone. This is made up of maxillae, right? Maxilla. Now, this frontal and maxilla, both of them together, they form what? They form the medial orbital margin. Medial orbital margin. They form the medial orbital margin. Now, in the center, can you see a suture over here? You can see a suture here. Yes or no? What is this suture called as? This is called as frontomaxillary suture. What is the name of the suture? This suture is called as frontomaxillary suture. Okay, what is this suture called as? This suture is called as frontomaxillary suture. Okay, so we are done with superior, inferior, medial wall. Now let us go on to the lateral wall over here. Now if you closely look at the lateral wall, what are the things you can see? So this entire wall over here, let me zoom in again. This entire wall over here is called as the lateral wall, and this lateral wall is again divided into, see, this is the upper part over here, and this part is the lower part. Okay, now upper part is formed by which bone over here? That is formed by, see, this part over here is formed by frontal bone. Lower part is formed by maxilla or zygomatic. It is formed by zygomatic bone. Zygomatic bone. So frontal and zygomatic together, they form what? They form, what is this? Yeah, they form the lateral orbital margin. They form the lateral orbital margin. Lateral orbital margin. In the center of lateral orbital margin, you see a suture here. You see a suture. This is called as frontozygomatic suture. Yeah, this suture is called as frontozygomatic suture. This suture over here is called as frontozygomatic suture. Okay, so these are the important sutures which you need to know over here that are associated with the orbit. Okay, next important thing is this particular part. What is this? Exactly above the orbit, can you see some kind of swelling over here and here, right? What are this swelling called as? See, this particular swelling over here, this kind of swelling, what you can see here is called as superciliary arch. What is this? This is called as superciliary arch. Next important thing is that, can you also see your nasal bone over here? This is your nose. Okay, what is this? This particular one over here is your nose. Now this opening over here is called as nasal aperture. What is this? This is called as nasal aperture. Okay, this particular opening over here is called nasal aperture. Now this if you look at this nasal aperture, this is called as the upper part of nasal aperture. This is called as the lower part of nasal aperture. Okay, so how many parts of nasal aperture we have got? We have got upper part of nasal aperture, we have got the lower part of nasal aperture. Okay, now tell me, upper part of nasal aperture is formed by what bones? Upper part is formed by two nasal bones. You see, two nasal bones are forming the upper part of nasal aperture. Lower part is formed by what bones? What is this? Maxilla. Here also you have got maxilla. Okay, so upper part of the nasal aperture is formed by what? Two nasal bones. And lower part of the nasal aperture is formed by what? It is formed by two maxillary bones. I mean maxilla on both the sides, two maxillae. Now you see a line between two nasal bones over here. Actually in this picture you cannot appreciate, but I am telling you there is a suture in between these two nasal bones. This is called as internasal suture. Okay, what is this suture, by the way? This suture is called as internasal suture. And you also see a suture here. Here you can see, right? You see a suture here in between two maxillae, right? This is called as intermaxillary suture. What is this? This is called as maxillary suture. So what are the structures that we discussed in norma frontalis, guys? What are the structures we discussed in norma frontalis? Norma frontalis is first of all made up of frontal, nasal, maxillary, zygomatic and mandibular bones. Okay, you have to identify the bones. When it comes to the orbit is a very important thing. We have got the supraorbital, we have got the medial, we have got the infraorbital, we have got the lateral. Okay, now when it comes to the supraorbital, junction between the medial 1/3 and lateral 2/3 of supraorbital region is having a small notch like this, right? Fossa or foramen. This is called as supraorbital foramen. Within this supraorbital foramen, you have got supraorbital artery, vein and nerve. Okay. Next, lower part is formed by two bones. See, this particular bone over here is called as your maxilla, and this particular bone over here is called as your zygomatic. And the suture between both of them is called as maxillozygomatic suture. In the same way, medial part is formed by frontal and maxilla, suture is called frontomaxillary suture, right? And here lateral part is formed by frontal zygomatic, suture is frontozygomatic suture. Okay, next important thing is that here you have got a swelling called as superciliary arch, and these are the nasal apertures. Upper part of the nasal aperture is two nasal bones and the suture is internasal, to maxillary, intermaxillary suture. So this explains the norma frontalis. So now we shall be discussing about norma lateralis. Okay, so what are the important things which you can see from the lateral view? Okay, now from this lateral view, first of all let us point out what are the bones which you can identify over here. Okay, you know, this is your frontal bone, and here comes your parietal bone, and this is your occipital bone, and all of you know this is your temporal bone. Okay, now next important bone which you can identify over here, right? All of you know that this is your maxilla. Okay, so this bone over here is called as your maxilla bone. Okay, next important thing, can you see the nasal bones? Only you can see one half of the nasal bone. Nasal bones are better visualized from fronta. What is this? You can visualize from norma frontalis, from the frontal view. Okay, now exactly here can you see this particular bone over here, right? So this particular bone over here is called as lacrimal bone. What is this? This is called as lacrimal bone. Now if you closely look to the lacrimal bone, within that lacrimal bone there is a depression. This depression within the lacrimal bone is called as lacrimal fossa. It is lacrimal fossa. How is that fossa, guys? The fossa is somewhat like this, right? It is somewhat like this, right? Now this fossa is having two important walls. See, this is called as an anterior wall, posterior wall. Okay, this anterior wall is also called as anterior lacrimal crest. Anterior lacrimal crest, and the posterior one is called as a posterior lacrimal crest. Between anterior and posterior lacrimal crest, you have got is whatever you have got is a lacrimal fossa, right? Now next important thing, what is this particular bone over here? This is called as your sphenoid bone. Okay, so exactly speaking over here, what is this part of the sphenoid called as? This is called as your greater wing of sphenoid. What is this? This is called as a greater wing of sphenoid. This bone is called as a greater wing of sphenoid. Next, what is this part of the temporal bone over here called as? This is called as the squamous part of the temporal bone. Squamous part of temporal bone. This is called as a squamous part of your temporal bone. Okay, and in the occipital bone, actually from the occipital side, from the posterior side, you can see this well. You see this entire bone over here. This entire bone over here is called as your occipital bone. Okay, this is your occipital bone. But at one point of the occipital bone, can you see a small protuberance over here? This is called, what is this protuberance called? External occipital protuberance. This is called external occipital protuberance. external occipital protuberance. This protuberance over here is called as external occipital protuberance. Okay, so these are some of the important structures which you can see. I mean, this is the just basic thing which I have talked. Let me discuss some more part with much more details over here. Okay, but by the way, I told you this is sphenoid, greater wing of sphenoid. Just remember this thing. Later on we will discuss about this in detail over here. Okay, next, down if you go, this is a bone with an attached mandible. Now if you look at the mandible is having two important process. See, this is one process over here. Here posteriorly we have got one more process. Okay, so what is this process which you can see posteriorly over here? This is called as condylar process. What is this? This is called as condylar process. This is called as your condylar process. This condylar process is the one which will be helpful for the formation of temporomandibular joint. Temporomandibular joint. Okay, so this condylar process is the one which will help in the formation of temporomandibular joint. Next, after this condylar process, this particular part over here is called as what? This is called as your coronoid process. Coronoid process. You have got one is called as a condylar process, right? Condylar process, and the other one is called as a coronoid process. Next, if I divide this mandible into half like this, right? So the upper part of the mandible over here is called as a ramus. What is this? This is called as a ramus of the mandible, and this part over here is called as a body of the mandible. What is this? This is called body of the mandible. Now down here near the body you can see a foramen over here. This particular foramen is called as mental foramen. What is this? This is called as mental foramen. So this particular foramen over here you call it as mental foramen. Now let us look at some more structures over here. Now what bone I have highlighted over here? This is a temporal bone which I have highlighted over here. Now in this temporal bone, if you carefully look, this part is called as a squamous part of your temporal bone. What is this? This is called as your squamous part of your temporal bone. Now to this temporal bone, what are the structures that are attached? You see a structure over here, a process over here. This is called as mastoid process. Mastoid process. Right? So within the mastoid process, for example, if there is infection, that is called as mastoiditis. You will have a very severe swelling at the back of the ear. Okay, right. Next important thing also you should know, for example, if this is a middle ear, okay, this is a middle ear. Middle ear is having, this is anterior wall, posterior wall, superior wall, inferior wall. I mean the roof, the floor. This is the roof, this is the floor. Now attached to the posterior wall you have got a process like this. This process is called as mastoid process, right? For example, if the posterior wall is broken, posterior wall of middle ear is broken, what will happen? The infection from the middle ear cavity can enter into the mastoid process, leading to mastoiditis. Okay, keep that thing in mind. So next important thing, what is this next important thing is that you see an opening over here. This particular opening over here is called as external auditory meatus. External auditory meatus. External auditory meatus. Okay. Now surrounding this external auditory meatus, you see this particular structure. This is called as a tympanic part. This is called as a tympanic part. So can I tell that the tympanic part is enclosing this external auditory meatus? Right, tympanic part is enclosing or surrounding, right? Tympanic part is surrounding, it surrounds your external auditory meatus. Next, down here you have got a sharp process like this. This sharp process is called as styloid process. What is this? This is called as your styloid process. Sharp process called as your styloid process. Next important thing, you have got a bone over here, right? What is this arch over here? This arch is attached to your zygomatic bone. You see, this is your zygomatic bone over here. Attached to the zygomatic bone, you see an arch. This arch is called as zygomatic arch. Zygomatic arch. This arch over here is called as zygomatic arch. Okay, what is this? Zygomatic arch. Now if you closely observe, let me rub this away. This is your zygomatic arch. If you closely observe, this is your frontal bone, right? And this is your zygomatic bone. Now between the frontal and zygomatic bone, can you see a suture over here? So this suture is called as frontozygomatic suture. What is this? Frontozygomatic suture. So what kind of MCQs will be asked from this is that they won't ask you sentence based questions, right? Rather they will ask you image based questions mostly here. Okay, in all these norma frontalis, laterals, what will be discussing right now, all of this, only the image based questions will be mostly asked from here. Okay, you have to keep that thing in mind. Now next important thing here, there is something that you already know. What is that? See here, what is this point called as? This point where all the bones are meeting here, yes, this is called as your pterion. What is this? Pterion. Okay, now once just tell me what are the bones that are taking part in the pterion. Yes, what are the bones that are taking part in the pterion? See, one bone you call it as a frontal bone. Frontal bone is taking part in the pterion. Next you have got a bone called as parietal bone. Frontal bone, parietal bone, and after that you have got another bone, temporal bone. Yes, you have got the temporal. When I tell temporal, which part of the temporal bone? Squamous part of your temporal bone. Next you have got the sphenoid bone. In sphenoid also, which part of the sphenoid bone? Greater wing of your sphenoid bone. Okay, now what are the structures that are present beneath this pterion? What are the structures that are present beneath this pterion? Are, all of you look here now, the first important structure is middle meningeal vein. What is that? Middle meningeal vein. Second important thing is anterior branch of middle meningeal artery. Anterior branch of middle meningeal artery. Okay. Next you even have got the Sylvian fissure, right? Sylvian fissure or Sylvian sulcus or the lateral sulcus or lateral sulcus. In neuroanatomy I have discussed what is lateral sulcus and all, right? So for example, if a patient is having fracture of pterion, what can happen? There can be rupture to this middle meningeal artery. If there is a rupture to this middle meningeal artery, that would lead to a condition called as extradural hematoma, EDH, or extradural hemorrhage. What is this? Extradural hemorrhage. Okay, extradural hemorrhage. Right, clear all of you now? So these are some of the important parts which you see on the lateral side. So guys, now we shall be looking at norma basalis. Okay, norma basalis, that is the base of the skull. So what are the structures that are present within this norma basalis? First of all, we will divide this entire norma basalis into three important structures. Okay, first what we'll do is that we will draw a line over here. What is this? What is this particular? Okay, let me tell you this. What is this particular structure over here? Yes, what is this particular structure? This particular structure is called as a posterior part of the hard palate. So what I am doing now, I am drawing a line along the posterior border of the hard palate. Next is that I am drawing a line along the superior margin. Okay, along the superior margin or the upper margin of your foramen oval. This is your foramen oval. This is the line which I am drawing along the upper margin of the foramen oval. So here I can divide this entire area into three parts. This is anterior part, middle part, and this is posterior part. So posterior part is not that important, but anterior and middle part, you can see here there are many structures that are located. These are very, very important. So first we shall focus on the anterior part, then middle, okay, and then we shall finish up this norma basalis. So first let us focus on to the anterior part. If you look onto the anterior part, right, now this anterior part is having few important things. For example, you see these structures which are located within the anterior part, these are looking like sockets, right? So these sockets are nothing but called as what? Alveolar arches. These sockets over here are nothing but called as alveolar arches. What are these? These are called as alveolar arches. Next, the structure that is present in the center is called as hard palate. What is this? This is called as a hard palate. And these arches over here are called as alveolar arches. Now if you go little bit detailed in these structures, what are the important things you can see? If I zoom in this, what are the important things you can see is that, can you see this part? Okay, yeah, this particular region, this is one half and this is the other half of the bone over here, other half of the hard pellet. So what are these two halves over here? These are called as palatine process of maxilla. You know, this is maxilla, right? So in the maxilla, this part is a hard pellet. So these two structures over here are called as palatine. How many are there? Two. Okay, these are called as palatine process of two maxillae. Palatine process of two maxillae. Palatine process of two maxillae over here. Next, just below this palatine process of these two maxillae, here you have got two more important structures. You see, below this palatine process, here you have got two more important structures. What are these two structures? These are called as horizontal plates of palatine bone. What are these two called as? These two over here is called as horizontal plates. Okay, they are horizontal plates of which bone? Palatine bone. Horizontal plates of palatine bone. How many are there? There are two. Here also there are two maxillae, I mean palatine process of maxillae. There are also two. Now between the two palatine process of this maxillae, right, between the two palates, so you have got a suture. You see, there is a line that is located in the center, right? You see a suture in the center, right? So this particular suture, let me use this color, yeah, this particular suture that is located in between both of them, right? So this particular suture over here, what do you call it as? Intermaxillary suture. You call them as intermaxillary suture. You call them as intermaxillary suture. In the same way, you also look at a suture that is located here. Okay, let me draw this. You also see a suture that is located here between the two palatine bones, right? This is called as interpalatine suture. Okay, so what is this particular suture called as? This is called as interpalatine suture. Interpalatine suture. This is called interpalatine suture. So between the two palatine process of two maxillae, you have got because guys, this part is your maxilla. Okay, this part is your palate, hard palate, right? So two halves of maxilla is called as a palatine process of two maxillae, and here you have got two parts of the palatine bone. So between the two maxilla, the suture is intermaxillary. Between the two palatine bones which are horizontally placed, the suture is interpalatine suture. In the same way, between the two maxillae on the top and two palatine bones down, you have got another suture. See here. You have got another suture here. What is this suture? This suture should be called as palatomaxillary suture because it is present between palate down and maxilla on the top. So you call this as palatomaxillary suture. This suture you call it as palatomaxillary suture. Palatomaxillary suture. Okay. Now, after discussing this palatomaxillary suture, if you look closely here, can you see a small spinous process over here? This spinous process is called as posterior nasal spine. What is this spinous process over here called as? This is called as posterior nasal spine. What is this spinous process called? Posterior nasal spine. Okay, this is called as posterior nasal spine. Right. Next important thing is that here exactly the same once again. Here if you see near the anterior most part, you can see a fossa. This fossa is called as incisive fossa. This fossa over here is called as incisive fossa. Okay. Now within this incisive fossa, you have got an artery called as nasopalatine artery. You have got an artery called as nasopalatine artery and vessels called as greater palatine vessels. Greater palatine vessels. It means greater palatine artery and greater palatine vein. These are the two important things that are located over here. Okay, right. So these are the structures which are located, and let us look at this structure also. Here you have got two important openings. You see here you have got an opening. Let me highlight this. Yeah, you see there is an foramen over here and there is another foramen over here. There are two foramens, right? So what are these two foramens? So this particular foramen, right, this particular foramen over here is called greater palatine foramen. This is called greater palatine foramina. What is this? Greater palatine foramina. And this particular foramina which you can see over here, right, this particular foramina which you can see over here is called as lesser palatine foramina. Okay, one you call it as a greater palatine foramina, this is called as lesser palatine foramina. What is present within the greater palatine foramina? What vessels pass? One is greater palatine artery, vein and nerve. What do they pass? Greater palatine artery, vein and nerve. In the same way, lesser palatine foramina, what structures pass? Same, lesser palatine artery, vein and nerve. Lesser palatine artery, vein and nerve. These are the three structures that pass through the lesser palatine foramina. Okay, so what are the structures so far we discussed in the hard palate? We discussed that we have got alveolar arches. Then next we have discussed very easy things, two palatine process of maxillae, and next we have got horizontal plates of two palatine bones. Between them the suture is intermaxillary. Between the palatine bones the suture is interpalatine. Between the maxillae and the palatine the suture is, what is this? This is called as palato-maxillary suture. And posteriorly we have got a spine called as posterior nasal spine. Okay, and here we have got a fossa called as incisive fossa, where we have got nasopalatine artery and greater palatine vessels over here. So these are some of the important structures which you need to know regarding the norma basalis. In norma basalis, as I already told you, here we are discussing regarding the anterior part of norma basalis, anterior part. Okay, now we shall be discussing regarding the middle part. Okay, we are done discussing the anterior part. Now we shall discuss about the middle part. Okay, now all of you can look at this particular part. This is the middle part over here. Okay, so from where does the middle part start? Middle part starts basically from the posterior border of the hard palate. So all of you can see here that this is your posterior border of hard palate, like this. Okay, you see this, this is a posterior border of hard palate. Okay, from here all the way till the upper margin of foramen magnum. This is the upper margin of foramen magnum. So an imaginary line is drawn along the upper margin of foramen magnum. This part over here is called as the middle part. Okay, so this entire part, and by the way, what is this? This is called as your posterior, what is this? Posterior border of hard palate. Posterior border of hard palate. Okay, and what is this line over here? This is an imaginary line drawn along the upper margin of foramen magnum. You know, this is your foramen magnum, and if that is your foramen magnum, then this will be the upper margin of foramen magnum. Okay, so this is a line drawn along the upper margin of foramen magnum, upper margin of your foramen magnum over here. Okay, now another important thing, what is another important thing over here is that and I can also divide this middle part into three parts. Okay, you see this particular part over here, right? So this particular part over here is called as a central part. Okay, this particular part over here is called as a center or the central median part, and this one over here is called as a right lateral part, and this is called as a left this will be the right lateral, right? So this is called as a right lateral part, and this one is called as a left lateral part. Okay, center part, and you have got the right lateral as well as the left lateral part. Clear? So but anyways, even if you put the right here, right there, that doesn't matter, right? So you have got the right lateral and the left lateral part. Another important thing you need to know is that you can see an opening over here. You know, what are these two openings here? These two openings over here are called as posterior nasal aperture. Posterior nasal aperture. These two openings are called as posterior nasal aperture. And if I zoom in, remove this part, can you see a bone over here? Yeah, you see, can you see this particular bone over here? This particular bone over here is called vomer. Can I tell that this particular vomer separates the two posterior nasal apertures? Yes or no? So this is the vomer in the center. This is what? This is the vomer in the center, and this vomer separates the two posterior nasal apertures. So this is one posterior nasal aperture, this is another posterior nasal aperture. So vomer separates two posterior nasal apertures. Okay, and by the way, this is your central part. Okay, central, right and left lateral part. Now if you look in little more details about this bone, okay, what is this? See, this entire bone over here, you see, this entire bone over here is called as your vomer. Now can I tell that vomer is divided into two parts, right? So what are these two structures called? These two structures are called as a ala of the vomer. What are these two structures called as? These are called as ala of the vomer. What are they called? They are called as a ala of the vomer. Now just beneath the ala of the vomer, you see, just beneath the ala of the vomer, you see this particular part over here. I'm rubbing it. Now just look at it. Right, so this particular part where I have kept a dot, this part over here is called as a rostrum of the sphenoid bone. What is this? This is called as a rostrum of the sphenoid bone. After rostrum of the sphenoid bone, you see another bone over here. You see another bone over here. Now this particular bone, this particular sphenoid bone, I am dividing it into two parts. This particular bone, I am dividing it into two parts. The upper part, whatever is there, it is called as a body of the sphenoid. Okay, above the body, this part is called as a rostrum of the sphenoid. This is called rostrum of the sphenoid. Below that you have got is a basilar part of the occipital bone. So what are the different structures we have got over here? See, this part over here is called as the rostrum of sphenoid bone. What is this? This is called as a rostrum of the sphenoid, right? After this, this part over here, what is this? This is called as a body of the sphenoid bone. This is called body of the sphenoid bone. And finally, this part over here is called as a basilar part of the occipital bone. Basilar part of occipital bone. Basilar part of the occipital bone. Okay, so these are the structures over here. Clear, all of you? These are some of the structures that are present in the base of the brain. Now this is how the real picture looks. This is how the real picture looks here near the base of the brain. So what are the structures? Once again, let us highlight over here. See, these two are called, okay, these two are called as posterior nasal apertures. Okay, and you see a bone that is separating both of them like this. This bone over here is called as a vomer. So vomer is divided into two alae. This is one alae and this is one alae over here. Clear? Next, just beneath that you see this part, right? This part is called as what? A rostrum of the sphenoid. Next, this entire body you see, this entire body, if I divide into two parts, right? This upper part is called as a body of the sphenoid. This is the basal part of the occipital bone. Okay, basal part of your occipital bone. So this is one very important thing. Now here there are some bones which I am going to highlight. See, look at this picture. I am just going to highlight some bones over here. Okay, again look back at this picture. Let us come from the periphery, complete periphery part. You see this green part over here, right? The same thing is over here also. You see this green part over here. This green part here which I am highlighting with the blue, this is called as a squamous part of your temporal bone. Just beneath the squamous part, just beneath, see this one, just beneath the squamous part, exactly here, you have got another part called as tympanic part. Okay, what is that? Tympanic part, right? So let me first of all write down all this. And by the way, you see this particular bone, see here, this one. Okay, you know what is this? This is called as petrous part. See here, it is already highlighted. This is called petrous part. So let us write down all these structures over here. Okay, let us write down all these structures over here. So what are the structures we have here in the lateral part? We are done with the median part, guys. Okay, we are done with the median part. In the median part, what we discussed nasal bones over here. Vomer bone we have discussed, ala of the vomer. Vomer divides separates the two posterior apertures. Next, down here we have got the rostrum of the sphenoid. Below that we have got the sphenoid bone. There is body of the sphenoid and the basilar part of the occipital bone. Right. After this, down here these colored bones. Let us name these colored bones one by one. Okay. So what is this first bone over here called as? This is called as pterygoid process. What is this? This is called as a pterygoid process. This is called as pterygoid process. Next, what is this particular bone over here called as? This is called as greater wing of sphenoid. Greater wing of sphenoid bone. What is this? Greater wing of sphenoid. Now coming to the remaining parts, which are very important. Okay. See, this part over here is called as a squamous part. This is called as a squamous part of your temporal bone. And still, what are the parts of temporal bone you have got? This part over here is called as the tympanic part. Okay. And this part over here is called as the petrous part. Petrous part. Petrous part. How many parts of the tympanic bone you have got over here? One you call it as a squamous part. Next you have got as a tympanic part. Next you have got as a petrous part. So all these are the parts of what? All these are the parts of your temporal bone. All these are the parts of your temporal bone. So how many parts of the temporal bone? You have got the squamous part of the temporal bone, tympanic part and petrous part, right? From the side view also you can see the squamous part. If you remember, see, you see this is a squamous part from the side view. Okay, so this is the part which we have discussed just now. Now, apart from this, another important thing you need to know is that, you know, this process is called as pterygoid process. Yeah. Within the pterygoid process, there are two plates. These two plates are called as pterygoid plates. Okay. Within the pterygoid process, you see two plates. See, here I am drawing these two plates like this. Okay. So, 1, 2, there are two plates within the pterygoid process. One is called lateral, another one is called medial. See here, this part is outside, this part is little bit inside. So, one is called lateral pterygoid plate, another one is medial. If you look at the next picture, you will understand. Look at this, right? Now, compare this with this. Where are the lines exactly you see? Look at this one. Now, where are the lines which I have drawn in between? You see, these are the lines over here. Okay. So, here it is divided into two parts. Okay, what is this part over here? Lateral pterygoid process. What is that? Lateral pterygoid. Lateral pterygoid plate. And this one over here is called as your medial pterygoid plate. Lateral and medial pterygoid plate. Okay, so pterygoid process is having two important pterygoid plates, lateral and medial pterygoid plates over here. Now, why am I telling you this? Why am I telling you this is that lateral pterygoid plate is very important. Why? Because this lateral pterygoid plate, all of you know about infratemporal fossa. Yeah. So from the side you can see this fossa. You see this fossa. This fossa over here is called as your infratemporal fossa. See this, all these dotted lines, whatever I have shown here from the side, this is your infratemporal fossa. Why? Because it is present below the temporal bone, infratemporal fossa. Now what I am telling you is that you just need to remember this an MCQ point, that this lateral pterygoid plate forms the medial wall of infratemporal fossa. Okay. So this lateral, what is this? Lateral pterygoid plate forms the medial wall of infratemporal fossa. Forms the medial wall of your infratemporal fossa. Right. Now, next important, you see, this is your lateral pterygoid plate, which is forming what? Which is forming the medial fossa of your medial wall of infratemporal fossa. Next, when you look at this particular bone, the same bone again, right? What was this bone here? This bone previously, what do you call this? This is called as your pterygoid bone, right? So, this pterygoid bone is having some openings. Don't you see any opening here? Yeah, let us try finding out some openings over here. See, here you see a small opening. Yes or no? And here also you see a small opening. So the same openings are highlighted over here. You see, there are some small apertures which you cannot appreciate obviously. If you can appreciate, then that is well and good. So there are two apertures that are located over here. Okay, so what are these two apertures? One is called as palatovaginal canal. See, this upper canal is called as palatovaginal canal. Palatovaginal canal, and this lower part, whatever is there, this is called as vomerovaginal canal. Vomerovaginal canal. Vomerovaginal canal. One is called as palatovaginal canal, another one is called as vomerovaginal canal. What is this palatovaginal canal? This particular palatovaginal canal, within this there are few structures that are located. Okay, let me write this. Palatovaginal canal. So what structures are located within this palatovaginal canal? The first important thing is you have got pharyngeal branches of pterygopalatine ganglion. What do you have? You have got pharyngeal, you just have to remember these things, okay? You have got pharyngeal branches. Pharyngeal branches of what? Pterygopalatine ganglion. Pterygopalatine ganglion. What is the second important thing you have got? You have got pharyngeal branches of third part of maxillary artery. Pharyngeal branches of third part of maxillary artery. Pharyngeal branches of third part of maxillary artery. Next important thing is that you have got vomerovaginal canal. Vomerovaginal canal. So what does this vomerovaginal canal consist of? Yes, what does this consist of? Pharyngeal nerve and vessels. Okay, it consists of pharyngeal nerve and vessels. So these two canals are completely consisting of pharyngeal parts, like pharyngeal branches of pterygopalatine ganglion, pharyngeal branches of maxillary, and pharyngeal vessels and nerves. So all the pharyngeal parts are located over here. Next, down if you go here, this is your greater wing of sphenoid, right? So in this greater wing of sphenoid, you see two openings here. What are these two openings? One oval shaped opening over here is called as foramen ovale. Foramen ovale. Okay, and one small opening just located below this foramen ovale is called foramen spinosum. Foramen spinosum. Okay, what is this opening? This is called foramen spinosum. And down here you see a canal over here. This is called as carotid canal. Carotid canal. So let us see what are the structures that are located. Foramen ovale, remember the mnemonic male, M-A-L-E. M stands for mandibular nerve. M stands for mandibular nerve. A stands for accessory meningeal artery. A stands for accessory meningeal artery. Next, L stands for lesser petrosal nerve. Lesser petrosal nerve. And E stands for emissary vein. E stands for emissary vein. So these are the structures that are passing out of foramen ovale. Then what are the structures that are passing out of this foramen spinosum? So through foramen spinosum, two important structures pass out. One is a recurrent meningeal branch of mandibular nerve. So one is your mandibular nerve. Mandibular nerve, exactly speaking, the recurrent meningeal branches of mandibular nerve. And next you will also see middle meningeal veins. Middle meningeal vessels. Okay, middle meningeal vessels in the sense middle meningeal artery, middle meningeal vein over here. Now what does carotid canal pass? Carotid canal will pass what? Internal carotid artery. And surrounding this internal carotid artery, there is a plexus. This plexus is called as sympathetic plexus. Always and always remember, when any large artery is passing, along with this large artery, the sympathetic plexus also passes. So this is the sympathetic plexus. Sympathetic plexus along with the carotid canal. And by the way, you have got another important opening over here. You see this? So this opening over here, right, is irregular, like it is like lacerated, right? So that is why you call this as foramen lacerum. You call this one as foramen lacerum. You call this as foramen lacerum. So when it comes to foramen lacerum, in the foramen lacerum, what are the structures you have got? One is emissary vein. One is you have got the emissary vein. Second one is you have got the meningeal branch of ascending pharyngeal artery. Meningeal branch of ascending pharyngeal artery. You know, external carotid artery branches which I talked in neuroanatomy. So one of the branch of external carotid artery is ascending pharyngeal artery. It has got a branch called meningeal branch. Okay, so that meningeal branch passes there. Okay, so these are some of the very important things which you need to know. Now if you go to the next important picture over here, so this one is squamous part of the temporal bone, right? You see, this is called greater wing of sphenoid. Just beneath that, this part, see, this is your, what is this? Greater wing of sphenoid. Just now we discussed, right? And below that, this is your squamous part of temporal bone. Next, after squamous part, what is this part? Tympanic part. We discussed this in this picture. You remember? This is squamous part. Below that, you will have tympanic part, right? So I'm again showing it to you here. This is squamous part. Below that, what do you have? Tympanic part. Between squamous and tympanic part, you have got a fissure. This is called as squamotympanic fissure. Why this is very important? Because this particular squamotympanic fissure is having the first important thing, that is chorda tympani nerve. Chorda tympani nerve. Second important thing is anterior tympanic artery. Anterior tympanic artery. And third important thing is anterior ligament of malleus. Anterior ligament of malleus. So these are the important things that are located within the anterior side. Okay, so this completes your norma basalis. Okay, so in the norma basalis, what are the important parts we have discussed over here, guys? We have discussed regarding the anterior part, very important, middle part over here. Okay, so these two are very important. And regarding the posterior part, we shall discuss it in the posterior cranial fossa. There we will discuss both the sides and we'll discuss all the important things over there. Okay, but anyways, anterior and middle are very important. So now we shall be discussing regarding all the different types of cranial fossa. Okay, so what are the different kinds of cranial fossa we have got? We will discuss right now. Okay, so all of you know this important thing. Let me draw this part, right? So if you look at the skull over here, okay, so if you look at the skull, right, so here this is the nose and these are the ears. Okay, now all of you should know one very important thing, that here you have got the sella turcica of the sphenoid bone. Okay, so here whatever fossa which I am drawing right now, right, so this particular fossa over here is called as anterior cranial fossa. Anterior cranial fossa. Here you have got the middle cranial fossa, and this is called as a posterior cranial fossa. In this way we have got three cranial fossas. So from the lateral aspect, if you see, this is how the picture looks. From the lateral aspect, you see, this is anterior cranial fossa, middle cranial fossa and posterior cranial fossa. Okay, this is the place where your brain is situated. Okay, so this is your anterior cranial fossa, this is your middle cranial fossa, and this is your posterior cranial fossa. We shall discuss about each one of this cranial fossa. First, discussing here, so this part over here which you can see, right, this part over here is called anterior cranial fossa, and this part which is head shaped over here is called as a posterior cranial fossa, middle cranial fossa, and this last part over here is called as your posterior cranial fossa. If you look at anterior cranial fossa closely, over here, you see this entire anterior cranial fossa is having this particular part. What is this particular part? We have to discuss right now. Okay, so what is this part which is located in the anterior cranial fossa? First important thing is that this center line, whatever you can see now, right? So this center line over here is called as crista galli. What is this center line called as? This is called as crista galli. So what is the use of this crista galli? Crista galli is the place where your flax cerebri is attached. Crista galli is a place where your flax cerebri, right? Your flax cerebri is attached. So crista galli is a place where your flax cerebri is attached. And what do you mean by flax cerebri, guys? Yes, what do you mean by flax cerebri? Flax cerebri is nothing but a fold of dura mater. Okay, for example, let me show this thing to you. You see this green color, right? So this is a fold of dura mater attached from one end all the way to the other end. So this place where it is attached over here is called crista galli, right? If I zoom in this picture, right, you see this line where it is attached in the center, this is called as crista galli. On both the sides you have got some bunch of foramens over here, right? So this is called as crista galli over here. So what is crista galli? Crista galli is the attachment point for flax cerebri. What is flax cerebri? Fold of dura mater. This is a brain over here. Okay, you see this line which is passing this layer. What is this layer here? This layer is dura mater. You see dura mater is coming all the way and it is folding. You see a fold of dura mater is going and attaching to this point over here. So that fold of dura mater which is attaching there is called as what? Flax cerebri. Okay, now here if you see on both the sides of crista galli you have got two plates. Okay, so all of you just look here, see both the sides of crista galli you have got two plates, which means see this is one plate, okay, and this is another plate. There are two plates located. These two plates are called as cribriform plate, right? So what are these two plates over here called as? These two plates over here are called as cribriform plate. These are called as cribriform plate. Okay, so cribriform plate is the one which is having foramina. So how many cribriform plates are there? Two. One on either side of what? Crista galli. It means crista galli is located in the midline, yes or no? Crista galli is located in the midline. So by the way, which bone is this first of all? This bone is called as a ethmoid bone. This bone is called as a ethmoid bone. So crista galli is located in the midline of the ethmoid bone over here. Okay, so if I put that picture down here, it will be much more easier for us to study. Let us say this entirely is the ethmoid bone. What bone is this? Ethmoid bone. The center of the ethmoid bone, you see this particular line, this line in the center of the ethmoid bone. What do you call this as? You call this as crista galli. Okay, this center line over here, you call it as crista galli. Okay, this is called as crista galli. Next, on either sides of the crista galli, you have got small foramens. On either sides of the crista galli, you have got small foramens over here. Okay, so these small foramens that are located on either side of the crista galli are called as cribriform plate. So this is one cribriform plate and that one is another cribriform plate. Cribriform plate. Okay, now on both the ends of cribriform plate, here you have got a very big opening on both the sides. Down also you have got very big opening on both the sides. Now what are these openings here? This is called as anterior ethmoidal foramen. Anterior ethmoidal foramen, and this one over here is called as posterior ethmoidal foramen. Anterior ethmoidal and posterior ethmoidal foramen. Okay, and in the same way you see there multiple small foramina, right? What are all these? These are all multiple foramina. Multiple small foramina are present over here. Now if you look carefully, from this multiple foramina you see a nerve that is coming out of this multiple foramina like this, right? You know what is the nerve that is coming out of this multiple foramina? These are your olfactory nerves. Okay, these are your olfactory nerves that are coming out of your multiple small foramina. So let us write down all these things over here. And by the way, totally what is this entire picture which I have drawn? This is your ethmoid bone. This is your ethmoid bone. Okay, so first, what are the foramens which we have over here? We have got multiple small foramina. We have got multiple small foramina. Next we have got anterior ethmoidal foramen. Anterior ethmoidal foramen. We have got posterior ethmoidal foramen. Anterior ethmoidal foramen. We have got posterior ethmoidal foramen. So through these multiple small foramina, what structures you see? You come across olfactory nerve. Olfactory nerve. Now anterior ethmoidal foramen, what do you have? You have got anterior ethmoidal artery. Anterior ethmoidal artery. You have got anterior ethmoidal nerve. You have got anterior ethmoidal vein. Okay. Now coming to this posterior ethmoidal foramen, what do you have? You have got posterior ethmoidal artery, vein and nerve. Okay, ethmoidal artery, ethmoidal nerve, ethmoidal vein, these are located over here. So these are the foramens and the structures that are passing through the foramens located in your anterior cranial fossa. Anterior cranial fossa, anterior cranial fossa over here. Clear? So let us go down over here. Right, you see this? You see what are all these nerves that are passing down? You see what are all these bunch of nerves that are passing here? These bunch of nerves which are passing are all called as olfactory nerves. Okay, olfactory nerves. Now this is the same image again, same image, I've just kept it here, but one very important clinical point I want to tell you here is that the most common fracture of this entire anterior cranial fossa, the most common fracture of anterior cranial fossa is what? What is that? That is the fracture of your cribriform plate. Fracture of your cribriform plate. So fracture of your cribriform plate is the most common fracture of your anterior cranial fossa. Now why? Because this cribriform plate is very thin. Okay, so this is the thinnest part of all. In the entire anterior cranial fossa, the thinnest part is cribriform plate. Even with your finger, if you tightly press, that cribriform bone will be fractured. Okay, so what will happen when there is fracture of this cribriform plate? That would lead to leakage of all the CSF. So you call it as CSF rhinorrhea. CSF leaks from your nose. Okay, CSF rhinorrhea. You call this as CSF rhinorrhea. Now when there is cribriform plate that is damaged, look at this plate. For example, if this plate is damaged, right, what will happen? Multiple small foramina will be disrupted. If multiple small foramina will be disrupted, that would lead to which nerve damage? That is olfactory nerve damage. That would lead to damage to olfactory nerve. Once olfactory nerve is damaged, will the patient have olfaction? No. That would lead to what? Anosmia. Patient cannot smell the things. Okay, loss of olfaction or anosmia. Clear? Now after that we will discuss about another cranial fossa, that is this part. Okay, you see this part of the cranial fossa which we have over here, this is called as your middle cranial fossa. Now in this middle cranial fossa, what are the important openings which you have over here? See, this particular opening which you have over here is called as superior orbital fissure. What is this? This is called superior orbital fissure. This opening is called superior orbital fissure. After that, this small round opening you see over here, this small round opening is called as foramen rotundum. What do you call this as? Foramen rotundum. Okay. After foramen rotundum, this oval shaped opening you call it as foramen ovale. You call it as foramen ovale. I think we discussed this earlier, right? Now beneath this foramen ovale, you see small opening here like a spine. This is called as foramen spinosum. Foramen spinosum. Okay, and finally this lacerated shaped opening here is called as foramen lacerum. Foramen lacerum. So in the middle cranial fossa, actually we have got many openings over here, right? So many foramens. So we have got superior orbital fissure, foramen rotundum, foramen ovale, foramen spinosum, and finally we have got foramen lacerum. Okay. Now what are the structures that are passing through this superior orbital fissure? So what are the structures that are actually passing through the superior orbital fissure? So through the superior orbital fissure, cranial nerve number 3 passes. After 3, what is the next number? 4. After 4, next what is the number? 5. After 5, what is the next number? We have got 6. Okay, so 3, 4, 5, 6. So when it comes to 5, all the 3 branches within the fifth cranial nerve, you have got ophthalmic, right? You have got maxillary, you have got mandibular. But which branch will pass here? Ophthalmic branch. Ophthalmic branch. Ophthalmic branch is also called as V1 branch. So we have got this ophthalmic branch of V1 over here. Okay. Now, when it comes to foramen rotundum, what does foramen rotundum pass? Again, foramen rotundum will allow the passage of the fifth pair of cranial nerve, that is your trigeminal nerve. Okay, so already we are done with the trigeminal nerve, one branch of trigeminal, that is V1. Okay, now here which branch of trigeminal nerve will pass? That is V2. What is V2? V2 is your maxillary branch. B2 is your maxillary branch. Now when it comes to foramen ovale, again fifth pair of cranial nerve, that is trigeminal, but this time which branch will pass over here? That is V3. V3 is what? V3 is your mandibular branch. V3 is your mandibular branch. Now when it comes to foramen spinosum, there are 3 important structures that pass through foramen spinosum. We have already discussed these structures. Okay, so what previously what did we discuss through foramen spinosum? What structures would pass, right? So here is the things which we have discussed over here, right? These are the structures from passing from foramen spinosum, right? So I am going to add up few more structures over here that pass through foramen spinosum. What are those structures? Remember M, 1, 2, 3. Okay, M stands for middle meningeal artery, middle meningeal artery. Okay, next middle meningeal vein, next meningeal branch of V3. Okay, meningeal branch of what? Meningeal branch of V3. Okay, these are the 3 things. Now when it comes to foramen lacerum, what are the structures that pass through foramen lacerum? Remember the name. Okay, N-A-M-E, name. What does N stand for? N here stands for nerve to pterygoid canal. N stands for nerve to what? Pterygoid canal. Nerve to pterygoid canal. So within this pterygoid canal, how many nerves we have got? We have actually got 2 important nerves. What are those 2 important? One is called as greater petrosal nerve. One is called as greater petrosal nerve. Another one is called as deep petrosal nerve. Greater petrosal nerve and deep petrosal nerve. Next, after that, after N, the second important one is A. A stands for artery to pterygoid canal. Artery to the pterygoid canal. Artery to the pterygoid canal. Okay. Next, M here stands for meningeal branch. Okay. M here stands for meningeal branch. Meningeal branch of what? Meningeal branch of ascending pharyngeal artery. Ascending pharyngeal artery. Okay, and finally E stands for emissary vein. E stands for emissary vein. So these are the structures that are passing through foramen lacerum over here. Okay, foramen lacerum over here. Now next important thing is that when I tell foramen ovale, I think I have already discussed there. There are other structures also passing, right? So here I am only discussing the nerves here, that is mandibular nerve only I have discussed, but you know what are the structures passing through foramen ovale, right? So where is the picture? Yeah, foramen ovale, it is male, M-A-L-E, right? So keep this thing in mind. Okay, so all these structures together I am discussing right now. Now after this, the next important foramen is foramens of the posterior cranial fossa. In the foramens of posterior cranial fossa, what are the different kinds of foramens you have got over here? You see, if I zoom in, you cannot see a foramen here clearly, but think that this is a foramen. Okay, so this is called as what? This is called as your internal acoustic meatus. What is this? Internal acoustic meatus. This is called as your internal acoustic meatus. After internal acoustic meatus, this part over here is called as your jugular foramen. This is called as your jugular foramen, internal acoustic meatus and jugular foramen. Okay, just beneath the jugular foramen, see this is your This is your jugular foramen. Okay, if you look closely, just beneath the jugular foramen, can you see a small opening? I mean, there is no opening over here, but think that there is an opening here. Okay, there is a small opening over here, right? In the real skull, you can see it clearly. This is called as hypoglossal canal. What is this? Hypoglossal canal. And need not to tell that this opening over here is called as foramen magnum, the large one, foramen magnum. This is called foramen magnum. Okay, now through this hypoglossal canal, what structures pass? That is your hypoglossal nerve will pass through this hypoglossal canal. What is the nerve that passing? Hypoglossal nerve. Hypoglossal nerve passes through this hypoglossal canal. Now, what are the structures that pass through foramen magnum? You know the most important structure. See, one is medulla oblongata. I am not telling total medulla oblongata, but the lower part of the medulla oblongata, slightly passes down the foramen magnum. Next, you see the spinal cord passing down, right? Okay, let me write this down. Spinal cord is passing down. Along with the spinal cord, attached to the spinal cord, don't you have meninges? Yes, meninges are also passing down. Next important thing is, let us say if this is foramen magnum. Okay, let us say that this is your spinal cord like this. If you remember, there are two arteries. So one artery is called right vertebral artery, this one is called left vertebral artery. So these vertebral arteries are arising from, one is arising from your right subclavian artery, this one is arising from the left subclavian artery. Right? So these vertebral arteries, both of them, they ascend up exactly in the pontomedullary junction, they join and form basilar artery. So it means the fourth important thing is your vertebral arteries. From these vertebral arteries, you see two branches are coming down, right? And they are supplying the anterior part of the spinal cord. So what are these? Anterior spinal artery. If I tell back of the spinal cord, that is posterior spinal artery, anterior and posterior spinal artery. And remember this last important thing, that a nerve passes there called as spinal accessory nerve. What is that? Spinal accessory nerve. Now in spinal accessory nerve, there is ascending part, descending part. So I am talking about ascending part of spinal accessory nerve, also passes through this particular opening. Okay, right. Next important thing, what are the structures that pass through jugular foramen? This one you just have to remember. If it is better, you name your own mnemonic. Okay, you frame your own mnemonic and then it would be easy for you. Okay, now what are the structures that pass through jugular foramen? In jugular foramen, the first important thing is your glossopharyngeal nerve. What is that? Glossopharyngeal nerve passes through jugular foramen. Okay, so glossopharyngeal nerve. After glossopharyngeal nerve is what? 9th. After 9, what do we have? 10. After 10, what do we have? 11. What is 10? 10 is vagus. And what is 11? Again, spinal accessory nerve. Spinal accessory nerve. Now this spinal accessory nerve is ascending or descending? It is descending, because ascending already is passing through the foramen magnum. Next, after this, next important thing is 4, 5 and 6. What are these 4, 5 and 6? One is jugular, is nothing but jugular vein. So internal jugular vein will pass. Next is inferior petrosal sinus. Inferior petrosal sinus will also pass. Okay. Now when I tell sinus, the largest one over here, sigmoid sinus. Sigmoid sinus, right? It's one of the sinus. Okay, one of the sinus. So these are the structures that are passing through the posterior cranial fossa. Okay. Hello guys, so now we shall be discussing regarding the different muscles of mastication. Okay, what are the different kinds of muscles we have got for mastication? Now out of all these muscles, so if you can look at this particular picture over here, this is the mandible and the hyoid bone down. Okay, so this particular muscle which you can see over here, right? So this particular muscle which you can see over here is your masseter muscle. Okay, this particular muscle over here is called as your masseter muscle. Now after this masseter, this particular muscle over here is called as your medial pterygoid muscle. What is that? Medial pterygoid muscle. Okay, after medial pterygoid, we have got lateral pterygoid also. So this muscle over here is called as lateral pterygoid muscle. One we have got is a medial pterygoid, another one we have got is the lateral pterygoid. Next, this particular muscle over here is called as temporalis muscle. Temporalis muscle. Okay. So, if you look at these muscles over here, the actions might be different, but I will tell you the actions. But if you see here, what are the muscles of mastication? There are four muscles of mastication. One is temporalis, lateral pterygoid, medial pterygoid, as well as masseter. Now, all these muscles of mastication are innervated by which nerve? They are innervated by mandibular nerve. They are innervated by your mandibular nerve. Now, if you look at the actions of this masseter, actions of all these muscles are attached to the mandible. So, they will cause either protraction or retraction or depression or elevation of the mandible, right? So, if mandible is moving forward, this is called protraction, like this. And if the mandible is moving back, that is called retraction. The mandible is moving up, elevation, and down, like this, that is a depression. Okay, so let us see what are the different actions of mandible we have got over here. So the first important action which you can see over here, for example, just look at the muscle and then answer. Let us look at temporalis, right? So temporalis, all the fibers are going up. You see, all the fibers are going up and back. Yes or no? So, if I ask you the action of temporalis, it is responsible for elevation of mandible and retraction of mandible. What is its action? Action is elevation and retraction of mandible. Just look at the fibers there. Retraction of mandible. If you look at lateral pterygoid, look at how the fibers of lateral pterygoid are projecting. Lateral pterygoid fibers are projecting front, right? Yes or no? Forward, and you see it is bending downward. So it means they are projected in this way, forward and downward in this way, forward and downward in this way. If the fibers are projecting forward, right, this is called as what? Protraction. Protraction. If the fibers are moving down, this is called as depression. Protraction and depression. Next important thing, look at medial pterygoid. The fibers of medial pterygoid are elevated and they are moving forward. Okay, elevated and they are moving forward, right? Now these fibers which are elevated and moving forward, you see they are elevated like this and they are moving in this way, right? So this is how the fibers are projected. So it means elevation and forward protraction. So the actions are elevation and protraction. What are the two actions here? The two actions are, one here it is called as protraction of mandible and elevation of mandible. Elevation of mandible. Protraction as well as elevation of mandible. Next important thing, if you look at the masseter muscle is also elevating, and if you follow the line, right, how it is going, if you follow the line, you see, isn't it going in this way? The masseter muscle is going like this back. So the action is elevation and it is going back like this, retraction. So what are the two actions? One is elevation and retraction of mandible, a retraction of mandible. And this particular muscle which is not a part of your mastication muscles, masticatory muscles, this is called as mylohyoid muscle. So just remember it, right? So what are the muscles of mastication? You have got lateral pterygoid, medial pterygoid, masseter and temporalis. Next, what are the actions of each and every muscle also you understood. What is the nerve supply also you understood, right? Now we have to identify the muscles. So how will you identify the muscles? So what is this muscle number 1 here which is present in the temporal region? The muscle number 1 which is present in the temporal region is your temporalis muscle. This is your temporalis muscle. Muscle number 2, yes, muscle number 2 that is present here near the angle of the jaw, that is your masseter muscle. Masseter muscle. Okay, if you are looking from the back, this is from the back. Okay, if you are looking from the back, what are these muscles over here? We have to discuss lateral pterygoid and medial pterygoid. Now 3B and 3A, which are located medially, which are located laterally? Obviously 3B is located laterally, 3A is located medially. So this is lateral pterygoid muscle, and this muscle over here is your medial pterygoid muscle. So one you have is the lateral pterygoid and the other one over here is called as your medial pterygoid. So these are the list of the muscles of mastication. So now we shall be discussing regarding the muscles of tongue. the muscles of tongue. Okay. Now, when we discuss about the muscles of tongue are divided into two groups. One is called as extrinsic, another one is called as intrinsic. Extrinsic as well as intrinsic. Now, when it comes to the extrinsic muscles, look what are the different muscles that are located over here. For example, if you can see this muscles which are present deep inside the tongue are called intrinsic muscles. Muscles which are supporting the tongue or present outside the tongue are called as extrinsic muscles. Okay. See, all of you know that here we have got a process called styloid process. Okay. From the styloid process, we see a muscle that is attaching to the tongue. You see, this is a muscle. From the styloid process, it is attaching to the tongue. Okay. So, let us say this is muscle number 1. Okay. Now, the next important muscle is all the way, you see this particular muscle, right? So, let us say this is muscle number 2. So, this is your second muscle. And third important muscle is that there is another muscle that is attached all the way. What is this bone over here? This is called as your hyoid bone. All the way from the hyoid bone, you see a third muscle that is attached over here. This is muscle number 3. So, here we can see 3 important muscles. What are the 3 important muscles? One muscle attached all the way from the styloid process to the tongue is called as styloglossus. Glossus is tongue. Okay. So, the first muscle is styloglossus muscle. Okay. Coming to the second muscle. Second muscle is called as genoglossus muscle. Genoglossus muscle. And coming to the third muscle, from the hyoid bone it is attached to the tongue. So, hyoglossus. Hyoid bone to the tongue, that is hyoglossus muscle. Hyoglossus muscle. So, these are the basic 3 extrinsic muscles which we have got. Okay, what is the function of that, and still are there any extrinsic muscles? There is one more extrinsic muscle, I will tell you later on. But what are the functions of this extrinsic muscle? These things we will discuss in a minute. Okay, but before that we will discuss about intrinsic muscles. What are intrinsic muscles? Muscles that are located inside the tongue are called intrinsic muscles. Okay, if you look at the tongue here, you can see, you see this is your tongue. Okay, so this is your tongue over here. This is your tongue. Now, if you look at the tongue, here on the top of the tongue, you see 2 important muscles here. See, this is called as superior longitudinal muscle on the left side. This is superior longitudinal muscle on the right side. Okay, when I remove these superior longitudinal muscles on the left and on the right, inside what muscles I have got? Inferior longitudinal muscles. So, one inferior longitudinal muscles on the right, inferior longitudinal muscle on the left. Okay. So, if I remove these inferior longitudinal muscles, inside what will be there? Vertical muscles will be there. So, overall, how many intrinsic muscles we have got over here? We have got 3 important intrinsic. One is called as superior longitudinal muscle on the right and left. Second we have got is the inferior longitudinal muscle on the right and left. And third thing we have got is a vertical muscles both on the right and left. Okay. Now, what is that one muscle over here? One extrinsic muscle over here is palatoglossus. What is palatoglossus? Again the same, all the way from the palate to the tongue, whatever muscle is attached, that is called palatoglossus. Okay. Right. If you look at styloglossus, what is styloglossus doing? See, this is your styloglossus. Muscle number 1 is your styloglossus, right? Wherever the arrow is pointed, that is your styloglossus. Right. Now, this styloglossus muscle, for example, if it will contract, it will pull the tongue back. Yes or no? It is attached to the tongue down. So, it will pull all of this back side. So, it is responsible for a retraction of the tongue. Yes or no? Also, it is responsible for elevation of the tongue. So, it is responsible for retraction plus elevation of the tongue. When you come to genoglossus, where is this? See, this is your genoglossus. Okay. So, genoglossus is attached, can I say that genoglossus is attached to the lower part of the tongue? Right. You see, from here it is attached to the lower part of the tongue. Right. So, don't think this muscle as genoglossus. No, this is not genoglossus. This is genoglossus. See, this genoglossus is attached to the lower part of the tongue. For example, if I am contracting this, what will happen? The tongue is depressed down. Okay. So, genoglossus is responsible for depression of the tongue. Along with that, one more action is protraction. Coming to hyoglossus. Hyoglossus is on the back. Yes or no? For example, if this entire hyoglossus, this is your hyoglossus muscle. Okay. So if this hyoglossus muscle is contracting, pulling towards the hyoid bone, what will happen? Your tongue is depressed or elevated? Depressed. Okay. So their tongue is depressed and it is moving back. You see, first your tongue will be depressed and then it moves back. So you call this as depression plus retraction, right? I hope you understood this. Once again, I'm telling you that look at hyoglossus. See, this entire muscle is your hyoglossus muscle. Okay. For example, if I am pulling the hyoglossus muscle, I will pull in this direction. When I am pulling this direction, what is going to happen? First, tongue will depress and then move back, right? Tongue will first depress like this and then move towards the hyoid bone. Depression and retraction, moving back. Okay. Now, important thing is that what is the nerve that is supplying all these muscles? So, all your extrinsic muscles. Okay, all your extrinsic muscles, all of them except the fourth one, remaining all are supplied by cranial nerve number 12. That is what? That is your hypoglossal nerve. What is that nerve? That nerve is called as hypoglossal nerve. Hypoglossal nerve. Okay. So next, coming to all intrinsic muscles are also supplied by cranial nerve number 12, that is hypoglossal nerve. Then what palatoglossus is supplied by? It is supplied by cranial nerve number 10, that is your vagus nerve. Okay, so remember this statement that all tongue muscles, both intrinsic plus extrinsic are supplied by cranial nerve number 12 except palatoglossus supplied by cranial nerve number 10, except palatoglossus, that is supplied by a cranial nerve number 10. So these are the muscles of the tongue which you basically have to know. So now we shall be discussing all the muscles of facial expression. What are the muscles of facial expression? So muscles of facial expression are divided into 5 groups. Okay, there are some of the muscles that are present in the cranium. There are some muscles that are present in the ear. There are some muscles that are present in the eye, not in the eye, I mean surrounding the eye. There are some muscles that are present on the nose, and finally there are some muscles that are present around the mouth. So all these muscles together, they will give some kind of expressions. Okay, so first I will tell you what are the names of this muscle. Later I will tell you what is the nerve that is innervating all these muscles. First we shall discuss about muscles of cranium. Okay, so the first important discussion would be regarding the muscles of the cranium. Now coming to the muscles of cranium. Coming to the muscles of cranium, they normally there are two important muscles. Okay, so there are two important muscles over here. One muscle is attached all the way from the frontal region to the occipital region. Actually, there is a muscle present in the frontal region. There is a muscle present in the occipital region. So connecting that, there is a tendinous sheath that is connecting the frontal to the occipital region. So you call this muscle as occipitofrontalis muscle. Okay, in the same way, from the temporal region to the parietal region also you have got a muscle that is called as temporoparietal muscle. So occipitofrontalis muscle and temporoparietal muscle. If you look at this picture, see here this muscle is occipital, this is frontal. So all the way from here till here, the muscle over here is called as occipitofrontalis. Okay, occipitofrontalis over here. And this particular muscle which you can see over here, it is attached to the parietal region and it is also in the temporal bone. So that is why this is temporoparietalis muscle. Okay, temporoparietalis muscle. Actually, Actually, if you look at this, there are only two muscles in the muscles of cranium. Okay, so what are the two muscles here? One is called as occipitofrontalis, another one is temporoparietal muscle. So let us write down all these muscles over here. Okay, so first we discussed about occipitofrontalis and temporoparietalis. Now after this, the next important thing is muscles of ear, muscles that are attached to the ear. So what are the muscles that are present towards the ear? Now all of you look at this. So let us say this is the ear over here. Okay, this is the ear, for example. You can see a muscle in front of the ear, you can see a muscle above the ear, you can see a muscle behind the ear also. Okay, so the muscle which is present in front of the ear will pull the ear to the front side. The muscle which is on the top will elevate the ear, will pull the ear to the top, and muscle which is on the back will pull the ear to the back. So pulling the ear to the front like this, front side, top and back, right? So these are the three actions that are done. So what are the names of these three important muscles? This muscle over here is called as anterior auricular muscle because it is attached to ear, so auricular muscle. Okay, next, this is called as superior auricular muscle. Okay, and next this one over here is called as posterior auricular muscle. Okay, we have got anterior auricular, superior auricular and posterior auricular. What does anterior auricular do? It pulls the ear anteriorly, it pulls the ear front or anteriorly. Okay, and here it pulls the ear cranially on the top, pulls the ear cranially. Okay, and here it pulls the ear backward. Okay, so these are the three muscles that are present around the ear. Okay, let us write down these three muscles. So what are the three muscles that are present that are surrounding your ear? One is called as anterior auricular muscle, second one is called as superior auricular muscle, third one is called as posterior auricular muscle, posterior auricular muscle. Okay, now after these muscles of ear, the next important thing is muscles of your eye. Okay, so what are the muscles of your eye? So again the same picture, yeah, this is a picture of muscles of the eye. So here exactly if you see, you can actually find two important muscles. Okay, so one muscle is surrounding the eyeball like this. So any muscle surrounding the eyeball is called as orbicularis. If it is a muscle surrounding the mouth, this is also called orbicularis, but this is called orbicularis oculi, and this is called as orbicularis ori. Okay, this is orbicularis oculi. Above this orbicularis oculi, you see two important structures like this, right? What are these two important structures? These two important structures are called as corrugator supercilii muscles. Okay, what are they? Corrugator supercilii muscles. So what do we have here? So here this circular muscle over here is called as orbicularis oculi, orbicularis oculi. And next this muscle on the top and this muscle on the top here is called as corrugator supercilii muscle, corrugator supercilii muscle. What is the function of, you need to know the function of orbicularis oculi. What is the function of orbicularis oculi? It is responsible for eyelid closure. It is responsible for closure of your eyelid. For example, if I want to squeeze my eyelids like this, very tight squeezing, this tight squeezing of eyelids is done by this orbicularis oculi muscle. So it is also responsible for squeezing, okay, squeezing the eyelid. Responsible for squeezing the eyelid. Not only that, it is also responsible for blinking. Also responsible for blinking. So squeezing the eyelid, and it is also responsible for what? Blinking. Okay, so these are the three important actions that are done by this orbicularis oculi muscle. Okay, so after this we have got your corrugator supercilii. So these are the two muscles that are present, right? And by the way, remember one thing, corrugator supercilii is responsible for creating a vertical fold. For example, when you put your face serious like this, right? When you are putting your face seriously in this way, you see a vertical fold here, right? So this vertical fold is done by this corrugator supercilii muscle. So corrugator super, and there is also another muscle which will create a vertical fold, I will tell you that, but this corrugator supercilii muscle will create a vertical fold over here. Okay, so let us write down what are the muscles over here that are present around the eye. What are the muscles? One is called as orbicularis oculi, another one is your supercilii corrugator supercilii muscle. Okay, these are the two important muscles. Next we shall discuss what are the muscles that are attached to the nose. Muscles that are attached to the nose. Okay, so let us say the muscle, let us show here, yeah, these are the muscles that are attached to the nose. Now out of these you can see two muscles over here, a pair of muscles. So these two muscles over here are called as procerus. What is this? Procerus. And what is the function of procerus actually? It will pull the skin between the eyelid. Okay, so it will pull, see, for example, if this is the eyelid, this is the eyelid, whatever skin is there, it will pull it together. It means again the same, the serious face whatever you keep. So let us see, let us look at this particular action over here. You see this action is done by which muscle? Your procerus muscle. Okay, so what is it doing? It pulls the skin between the eyelids. It pulls the skin between the eyelids. Okay, after that you have got these two muscles over here which we discussed here, right? So these two muscles over here are called as nasalis. What are these two muscles? Nasalis. What are nasalis? What do these nasalis do? Nasalis is responsible for widening of the nostrils. They're responsible for widening of nostrils, right? For example, if I am contracting nasalis like this, what is happening? If I am contracting nasalis in this way, you see my nostrils have been widened, right? So that is responsible for widening of the nostrils here. Okay, next important thing is this particular muscle. What is this muscle over here attached to the nose? This is called as depressor septi nasi. What does this depressor septi nasi do? This will pull the nose down. So if I contract this muscle, this is how the nose is pulled down. See here, right? So this is depressor septi nasi which is responsible for pulling your nose down. Okay, so what are the three muscles that are attached to the nose? So these are the muscles that are attached to the nose. So what are the three muscles that are attached to the nose, guys? Yes, what are the three muscles that are attached to the nose? Once again, let me write these muscles over here. Yeah, one is called as your procerus. Next muscle is called as your nasalis, and third is called as depressor septi nasi. These are the three important muscles that are present towards the nose. Now let us look at the muscles that are present around the mouth. There are many muscles that are present around the mouth. Okay, so for easy identification purpose, what I will do is that I will just draw one picture and explain you the muscles, then I will show it to you in the 3D animated picture over here. Let us say, for example, this is your mouth. Let us say this is the mouth. Okay, now one important muscle you should always know, that surrounding the mouth, you see, surrounding the mouth there is a muscle that is already present, right? So surrounding the mouth there is a muscle that is already present over here. What is this muscle that is already present, that is surrounding the mouth? Yes, this is called as orbicularis ori muscle. What is this? Orbicularis ori muscle. Let me write this down. So this muscle over here is called as Orbicularis ori muscle, orbicularis oris or ori muscle. Okay. Next, after this there is another muscle. Okay. Yeah, there is another muscle that is located on the top here. There is another muscle that is located on the top. Now, what are these two muscles? See, these two muscles are attached to the upper lips. So that is why they are going up. Okay. In the same way, there are another two muscles that are attached to the lower lip. So they will go down. They are attached to the lower lip. So obviously they will go down like this. So these are the two muscles that are attached to the upper lip. When I tell upper lip, superior labii or inferior labii? Superior labii. So if these muscles will contract, what will happen? My upper lip is elevated like this, like this. My upper lip is elevated. Okay. How is my upper lip getting elevated like this? It is because of levator labii superioris muscle. So what will be the name of this particular muscle? This muscle is causing elevation. Elevation you call it as levator. Elevation of what? Upper lip. Upper lip you call it as labii, and to the top, I mean, which labia is superior or inferior? Superior labia. So superioris. Labii superioris. Now, what will this muscle do? These two muscles, they will cause a depression, right? So if these muscles are causing elevation, these muscles are causing depression of your lower lip. So you call this as depressor. What do you call? Lower lip. You call it as depressor, and depression of what? Your lip. Which lip? Lower lip. Depressor labii. Which one you have to write? Inferioris or superioris? Inferioris. Depressor labii inferioris. So one we have got is the levator labii superioris. One we have got is a depressor labii inferioris. Finish. Next important thing. Next important thing is that we have got two more muscles. Okay. See, this is the upper lip, this is the lower lip. This is called as the angle of the mouth. Now to this angle of the mouth, we have got few muscles. For example, if you look at one angle, here, exactly here we have got one muscle. Okay. Same angle on the opposite side also we have got a muscle over here. Down also to one angle we have got a muscle. Here also we have got a muscle. It means here there is one muscle, here there is one muscle, here and here. So what will these two muscles do? Obviously muscles which are on the top will always cause elevation. So elevation you call here as elevation. So first write it as levator. Levator. Levator of what? Angle of the mouth. Elevation of what? Elevation of what? Angle of the mouth. So anguli oris. Anguli oris. Okay. So it means this action in this way. You see, if the same thing is happening down, because the arrows will be down, so this is called depression of the angle of the mouth. So depressor anguli oris, depressor anguli oris. So both of them, the right and left, both of them are levator anguli oris, depressor anguli oris. More laterally, we have got two more muscles. More laterally, we have got two more muscles. See, here we have got a small muscle like this, and here we have got a large muscle like this. Okay. Here also on other side also we have got these muscles. Only on the top, not on the bottom part. Only on the top you have got these muscles. So what are these two muscles over here? What will you name them? This muscle over here is called as zygomaticus major or zygomatic major. Okay. Sorry, this is small, so minor, and this is zygomatic major. One is zygomatic minor, another one is zygomatic major. Next important thing is that, see, what are the muscles that are located here? Depressor labii inferioris. Just inner to this depressor or medial to this, here exactly, okay, exactly here you have got two important muscles. Here you have got two important muscles. So what are these two important muscles that are located over here? So these two important muscles over here are called as mentalis. What are these two muscles called as? Mentalis. Okay, because they are present in the mental region. Now let us just have a recap of all these muscles. Muscles which are located on the upper lip are called, they will elevate. Muscles are located on the upper lip, they will pull the upper lip upward. So that is why levator labii superioris. Opposite of that wills, opposite of elevation is a depressor labii inferioris. Where is that located? Down. Depressor labii inferior, that will depress the lower lip. Next, angle of the mouth is having 4 muscles like this. What are these 4 muscles? Levator anguli oris, because angle of the mouth. So opposite action is depression. So depressor anguli oris. The round muscle is orbicularis, which is responsible for kissing like this. So if you want to close your mouth, that is orbicularis oris. Right. Next important thing is zygomatic minor, zygomatic major. I'll tell you the actions of this later on. I'll show you these muscles first of all. So first of all, just look at these muscles over here. Now tell me, what are these muscles? So here, what are these muscles which you can see? What are these 2 muscles which are looking up? These are called as levator, yes, labii superioris. Then opposite to that, what do we have? What is this? This is levator labii inferioris. After that, to the angle of the mouth, I told you. See, to the angle of the mouth here, what is this? Levator anguli oris. And what are these muscles? Depressor anguli oris. Levator anguli oris, depressor anguli oris. And what is this round muscle? This is orbicularis oris muscle. Okay. If you look at this, what did I tell you? More laterally, you will have 2 more muscles, I told you. Okay. So what are those 2 more muscles? See, this particular muscle over here is called as zygomaticus minor. And this muscle over here is called zygomaticus major. Zygomaticus major. And more down, if you see this muscle attached to the mandible here. This is called as risorius muscle. What is this? Risorius muscle. And finally, inside to risorius, you see another small muscle. This is called as buccinator muscle. Risorius, and other muscle is buccinator muscle. Okay. So let us what we do is that let us write down the list of all these muscles over here. Okay. Let us write down the list of all these muscles that are attached to the mouth. So what are the list of muscles that are attached to the mouth? So one by one, guys. So first muscle which we have to discuss over here is, what is that? What is the first muscle which we have to discuss? That is your orbicularis oris. Orbicularis oris. After orbicularis oris, 2 muscles located on the top. What is this called as? Levator. Yes, this is called levator labii superioris. Next, we have got depressor, right? We have got depressor labii inferioris. Depressor labii inferioris. Okay. Next, to the angles of the mouth, what do we have? We have got levator anguli oris. Okay. And down, what do we have? We have got depressor anguli oris. Depressor anguli oris. And sixth important thing, what do we have? We have got zygomaticus minor. We have got zygomaticus major, zygomaticus minor and zygomaticus major. Okay. And eighth muscle, what do we have? We have got mentalis muscle. Mentalis. After that, ninth muscle, what do we have? Risorius. And finally, we have got the 10th muscle, that is your buccinator muscle. Okay, the 10th muscle over here, the last muscle which you have is buccinator. So these are all the muscles of the facial expression, and remember, all these muscles of facial expression are innervated by 7th pair of cranial nerve. Okay, all of them are innervated by 7th pair of cranial nerve. Okay. Now after these muscles of facial expression, we shall discuss the muscles of the eyeball. Okay, muscles of the eyeball, which you also call it as extra. We are done with muscles of facial expression. Now I am discussing muscles of eyeball, muscles attached directly to the eyeball. They are called as extraocular muscles, because these are the muscles not present inside the eyeball, rather they are present outside the eyeball, responsible for the movements of the eyeball. Okay. These are called as extraocular muscles. So what are the list of extraocular muscles? For example, let us say this is the eyeball over here. Okay, this is the eyeball. Next, let us draw the nose over here. Right. So let us draw the nose. Now look here. Wherever the nose is there, that is the medial side, right? So what are the muscles over here? Here we have got a muscle which is on the top. So superior and it is straight. So rectus, superior rectus. Here we have got a muscle. This is called inferior rectus. And a muscle towards the nose is called medial rectus. Muscle laterally located is called lateral rectus. Okay. So what are the names so far? One is called as superior rectus. This muscle over here is called as medial rectus. Okay, and this is called as inferior rectus, and finally we have got our lateral rectus muscle. So what does these muscles do? What do these muscles do? Medial rectus, if I am contracting medial rectus, what is happening? See, if I am contracting medial rectus here, both my eyeballs are looking towards my nose in this way. Okay, so this is called as your medial rectus. Next, if I am looking up, it is because of superior rectus. If I am looking down, this is because of inferior rectus. If I am looking to the right, look at my right eyeball looking to the right, ignore my left eyeball, look at my right eyeball looking to the right, it is because of my lateral rectus which is located over here. So every muscle has its own action. Now you know the actions, right? So superior rectus is responsible for what? Elevation of the eyeball. Not only elevation, this is the primary action. There is secondary and tertiary action also. That thing I will tell you later on. But primary actions you should know. Inferior rectus for depression of the eyeball. Medial rectus, if you are looking towards the midline of your body, this is called what? Adduction of the eyeball. Adduction of the eyeball. And this is called as what? Abduction of the eyeball. Adduction and abduction. These are the actions. Okay. Now after this, what is a nerve that is innervating all these muscles is, you have to know SO4, remember a formula, SO4 LR6 SO4 LR6 R3. SO4 LR6 R3. What do you mean by SO4 LR6 R3? SO4, see, there are two more muscles that I have to tell you. First of all, here I forgot. So what are those two more muscles are? There is one muscle that is present on the top like this. There is one muscle that is present on the bottom part. Okay, the muscle that is present on the top is called superior oblique, inferior oblique. What is that? Superior oblique muscle, and this is inferior oblique. What are its actions? I'll tell you later. So remember that this is superior oblique and inferior oblique. So superior oblique is innervated by which nerve? Fourth pair of cranial nerve. Lateral rectus is innervated by which nerve? Sixth pair of cranial nerve. Leaving ये दोनों छोड़ के बाकी सब rest, R stands for rest. Rest all are innervated by third pair of cranial nerve. These are the nerve supplies which you need to remember. Okay. Now coming to the action of each and every muscle. I will draw a diagram. So remember the actions in that particular picture. Okay. So most of your questions will be solved from that. Let us say this is your eyeball over here. This is your eyeball. Okay, and let me draw the nose over here. So this explains that what? This is your lateral side where the nose is there, that is your medial side, right? Now one very important thing is that, what did I tell you? The superior rectus, this is your superior rectus. One very important thing is that the muscle that is located towards the nose, what is that muscle called as? MR. MR is medial rectus. The muscle that is located towards the temporal region is called as LR. LR stands for lateral rectus. So these actions are not changed. Medial rectus will cause what does it cause? Adduction. Lateral rectus will cause abduction. Both of them are same. But the muscles of superior, inferior rectus, superior oblique, inferior oblique, only their actions will change. Okay. If an eyeball is looking upward, you call it as elevation or depression? You call it as elevation. Elevation is on the top, then depression will be on the bottom. Depression will be on the bottom. Okay. Now what you do is that just keep drawing the arrows. Okay. So see here, I am drawing one arrow onto the top, one arrow on this side. Exactly opposite to that, I am drawing one arrow onto the top and changing the direction. Exactly opposite down, I am drawing one arrow like this, So previously it was upward, now downward. Again the same thing, upward, now downward. You see, I don't think so these arrows are difficult. What did you do now? You wrote down lateral rectus, medial rectus. You know this from the previous picture only. New things? No new things. So here, if the eyeball is looking upward, you wrote it as elevation. If the eyeball is looking downward, you called as depression. Okay. Next important thing, you have drawn these arrows. Now what I am telling you is that I am telling you that this is a place where the superior rectus will act. Now don't confuse here. I am writing now the actions of the muscles. Okay, for example, here is the action of inferior oblique. Now you might get confused that inferior oblique to niche hai, it is down, but now inferior oblique you are putting up. This is not the muscle. This is the action of inferior oblique. If muscle wise, location wise if you are speaking, this is the picture. Action wise if you are speaking, then this is a picture. So superior oblique will come here, okay, and superior rectus ko opposite is inferior rectus. Inferior rectus will come over here. Okay, this is the thing you have to remember. Clear? Next important thing, if the eyeball is rotated in this way, this is called intorsion. What is that? Intorsion. If the eyeball is rotated towards the opposite side, it means towards the temporal side, that is called extorsion. What do you call? Extorsion. So for example, here I am writing intorsion. Intorsion. So just you need to remember intorsion at one place, where? Near the superior rectus. Baki sab, it will be the opposite of that. Opposite of that in the sense what? Whenever I tell intorsion, you should tell extorsion. See, I am telling intorsion. So what will be here? Extorsion. It will be extorsion. If I am writing extorsion here, then what will be down over here? Intorsion. What will be down? Exactly the opposite. See, opposite of intorsion, you told me extorsion. Opposite of extorsion, now you will tell me what? Intorsion. Here it will be intorsion. Intorsion. Opposite of intorsion, what will you tell me again? Extorsion. So here you have to tell extorsion. Actually, I can also teach you conceptually what is intorsion, what is extorsion, how the muscles are moving and all, but this will be very, very difficult. Okay, at the end we have to depend upon this picture only. So instead, as this is a rapid revision session, it is better we discuss only this picture and finish it off. Okay, so if they ask you in the exam, what is the action of superior rectus, what will you tell? Superior rectus is having how many arrows? 1 and 2, 2 arrows. So upward arrow is for elevation and the arrow towards the nose is for intorsion. So superior rectus action is elevation and intorsion. Next, inferior rectus action. Inferior rectus action is depression and extorsion. What is that? Depression and extorsion. Next, inferior oblique action. Inferior oblique action is again elevation and extorsion. What is that? Elevation and extorsion. Lateral rectus has got only one action, moving the eyeball that way. Superior oblique action. Superior oblique action is depression and intorsion. So if you remember this picture, then most of your MCQs will be clear. So this is all you need to know regarding the extraocular muscles. So now we shall be discussing regarding the cervical ganglia, right? First of all, we shall start our discussion with the sympathetic ganglia. Okay, so what are these sympathetic ganglia? We will discuss now. Sympathetic ganglia. So our topic of discussion would be regarding the sympathetic ganglia. So in the sympathetic nervous system, in the sympathetic ganglia, how many basically in this sympathetic ganglia, how many sympathetic ganglia are present? First of all, if you see the vertebral column, okay, let us say this is C1 vertebra, C2 vertebra, C3, C4 and so on and so forth. Okay, lateral to this vertebral column, you have got ganglia. You see, this ganglia is nothing but called as a sympathetic trunk, right? This sympathetic trunk is consisting of a chain of ganglia like this, right? So these chain of ganglia are called as sympathetic ganglia. Some ganglia are located in the cervical region, you call them as cervical ganglia. Some are located in the thoracic lumbar region, you call it as thoracic or lumbar ganglia, lumbar sympathetic ganglia. So if you look at the sympathetic ganglia over here, these sympathetic ganglia, from where do they start? First of all, they start from the base of skull. Where do they start? They start from the base of skull all the way they extend till what? They extend till the coccyx. Okay, they extend till the coccygis. How many pairs on both the sides you have got? So how many pairs of sympathetic ganglia you have got? Around 22 to 23 pairs of sympathetic ganglia you have got. Okay, where are they located? They are all located lateral to the spine. Lateral to spine. So today's discussion will be discussing one of the most important ganglia, sympathetic ganglia, that is cervical sympathetic ganglia. Okay, so in the cervical region, how many sympathetic ganglia you have? In the cervical region, I have got three sympathetic ganglia. What are those three sympathetic ganglia? One is called superior cervical ganglia, middle cervical ganglia, and inferior cervical ganglia. Okay, so I have got superior cervical ganglia. Okay, I have got middle cervical ganglia and inferior cervical ganglia. I have got these three ganglia: superior cervical, middle cervical, and inferior cervical. Now, where are these superior cervical ganglia located? They are located anterior to C1 to C4 vertebra. C1 to C4 vertebra. Where is middle located? Anterior to C6. Where is inferior located? Anterior to C7. Okay, where are all these vertebra located? Where are all these ganglia located? It is located in front of C1 to C4 vertebra. Middle is located in front of C6. In front of C7 you have got the inferior. Okay, for example, this is the thing. See, these are the three ganglia: superior, middle, and inferior. Right? You see, this is C1 all the way, C1, C2, C3, C4. Till here you have got what? Superior cervical ganglia. Next, middle cervical ganglia located in front of what? C6. And inferior cervical ganglia located in front of C7. Okay. Now another important thing is that let us discuss what are the branches of these particular cervical ganglia. Okay, but before we discuss branches, what I will do is that I will draw three sections of spinal cord, and then I just wanted to explain few important things. Okay, for example, what I am trying to tell you is that, let us say this is your spinal cord, a section of your spinal cord. Okay, now in this section of the spinal cord, all of you know that this is your dorsal root ganglia, right? So from the ventral side also you see the branches coming here. Now the dorsal horn, ventral horn, right? The dorsal horn, ventral horn, both of them, they join together and form what? Spinal nerve. What is this? This is what is called as your spinal nerve. Now this particular spinal nerve will divide into two important branches like this. What are these two important branches to which it is dividing? One is called as a ventral ramus, another one is called as a dorsal ramus. So it means this spinal nerve, this is your spinal nerve dividing into two rami. One is called as a dorsal rami, okay, and this one over here is called as your ventral rami. The lower one over here is called as your ventral rami. This particular ventral rami is having two more branches. Okay, what are these two more branches of ventral rami? Look here, this part over here, this branch over here is called as your white ramus, and down here whatever you have over here is called as your gray ramus. Okay, what is this? One branch over here is called as your white ramus, another one is called as your gray ramus. Now, where is this white ramus and gray ramus attached to? These white ramus and gray ramus, they are attached to your respective ganglion like this. You see, they are attached to the respective ganglion. What is this ganglion? This is a sympathetic ganglion. So, this is one sympathetic ganglion. Now, this sympathetic ganglion is having a chain like this. Okay, it is having a chain like this. Now what is going to happen is that, okay, let me just wipe this away. Right, now you understood this, so what is this particular structure? This particular structure over here is called as ganglion. And what is this ganglion? This ganglion is this particular ganglion which I have shown you here. All these are the sympathetic ganglion. Now in the cervical region, how many sympathetic ganglion will be there? I told you 3: superior, middle, and inferior. Think that this is a superior cervical ganglion. Okay, then where is the middle? Where is the inferior? Look here. So this is how the picture follows. If I make a copy of this, you see another, let us say another ramus getting attached over here. Another ramus is getting attached over here. Okay, if I duplicate this again, there is another ramus that is going and getting attached over here. You see now? So, how many cervical ganglia are there over here? There are 3 cervical ganglia. So, can I tell that this is superior cervical ganglia, this is middle cervical ganglia, and this is your inferior cervical ganglia. So, how many are there? Superior, middle as well as inferior. Now, first itself I am telling you, superior cervical ganglia is attached to the spinal cord indirectly. How? It is attached with the help of this gray ramus. So this is a communicating branch. Even white ramus is also there, but I am speaking about the gray ramus. You see, there is a gray ramus, right? With the help of this gray ramus, what is happening? This superior cervical ganglia is attached to which rami? Dorsal or ventral? It is attached to the ventral rami of the spinal cord. So what is this particular branch called as? This particular branch here is called as what? Communicants. What communicants? Gray rami communicants. What is this? Gray rami communicants. So this gray rami communicants, okay, what is this? This is gray rami communicants. This is the gray rami communicants of what? Superior cervical ganglia. How many gray rami communicants will be there for superior cervical ganglia? 4. Okay, so what are these 4? C1 to C4. Now I know you did not understand. What I am trying to tell you is this. See, for example, this is your superior cervical ganglia. Attached to the superior cervical ganglia, can you see some lines here? What are these lines? These lines are nothing but called as gray rami communicants. So, how many spinal cord segments these gray rami communicants are attached from the superior cervical ganglia? C1, C2, C3 and C4. But I have drawn how many segments? I have just drawn one segment showing you all the way from C1 till C4. I hope you understood now. Okay. So each cervical ganglia will give 4 branches that will cover up 4 different sections of segments of spinal cord. Okay, right. Now coming to the middle one. Middle is also having gray rami. Now this will cover how many sections of spinal cord? Only 2. That is gray ramus communicants C5, C6. And inferior will cover up how many? It will cover 2. That is C7 and C8. Now the first branch is that from the superior cervical ganglia, let me put up all this picture down so that I will save some space on the top. Now coming to the first branch, what is the first branch over here? First branch is that let us say that we have got common carotid artery. You see, this is called as your common carotid artery. This common carotid artery is divided into 2. One is called as external carotid, another one is called as internal carotid artery. Okay, so what is this? This is called as external carotid artery. This is called as internal carotid artery. Okay. Now what I am telling you is that you see this from the superior cervical ganglion. You see a nerve that is going away, and this nerve is completely winding. This nerve is completely winding what? It is completely looping what? This nerve is completely looping your external carotid artery. It is forming a plexus around this external carotid artery. So this is called as external carotid nerve. What is this external carotid nerve doing? This is coming from the superior cervical ganglion, completely looping your external carotid artery. In the same way, let me draw this particular picture. Let us say that this is your eyeball. Okay, this is your eyeball and these are your eyelids. Now you should know one very important thing, that here on the top of the eyelid you have got a muscle over here, right? You know what is the name of this particular muscle? The name of this particular muscle is Muller's muscle. What is this? This is called as Muller's muscle. What is the other name for Muller's muscle? Superior tarsal muscle. Superior tarsal muscle or Muller's muscle. And what does this do? This will cause a retraction of the upper eyelid. It means it will open the eyelid. Okay, but powerful retraction? No, just minor retraction of upper eyelid. Okay, upper eyelid. Now let it be here. Now let us go back to our topic here. What is the thing? Now from the superior cervical ganglion another nerve is coming, right? So from the ganglia, if any nerve is coming here, guys, let us say if this is a nerve, this is a nerve that is entering into a ganglia, and from the ganglia a nerve is going out. Now can I tell that this fiber is preganglionic and this is postganglionic? It means all these are postganglionic fibers. So can I tell that there is one postganglionic fiber now that is ascending up? Okay, this will ascend up like this, and now this postganglionic fiber is completely surrounding what? It is completely surrounding your internal carotid artery. Okay, so this nerve is called internal carotid nerve, and finally after making a plexus around internal carotid nerve, this will go and innervate your Muller's muscle. Okay, this will go and innervate your Muller's muscle. So first important thing is that here it has given superior cervical ganglion has given two nerves. One is external carotid nerve, another one is called as internal carotid nerve, which is innervating your Muller's muscle. Okay, next, apart from this, what are the other branches? So it will give another branch that is called as nerve to what? Pharyngeal plexus. Nerve to pharyngeal plexus. Okay, apart from this, after nerve to pharyngeal plexus, it will give away one more nerve. What is this nerve called as? Superior cardiac branch. What is this branch? Very important branch. What is this? Superior cardiac branch. Superior cardiac branch. What does this superior cardiac branch do? It will form cardiac plexus. Okay, when I tell superior cardiac branch, then from the middle one you will have a branch called as middle cardiac branch. Yes or no? Then from the middle one you will have a branch over here called as middle cardiac branch. When I tell middle cardiac branch, you will also have another branch from the lower one. This is called as inferior cardiac branch. Yes or no? Middle cardiac branch, and the last one is called as inferior cardiac branch. Okay, now let us go back to the discussion. One is superior cardiac branch. Next is it will also give a postganglionic nerve, and these nerves, they pass along with which cranial nerves? They pass along with, see, if this postganglionic nerve is passing along with different cranial nerves. Here there is 2, 3, 4, 6 or whatever cranial nerves are there. Along with these cranial nerves, these nerves are also passing. So this gives out nerves that pass along what? Along cranial nerve number 2, 3, 4, 6 and 9. Cranial nerve number 2, 3, 4, 6 and 9. Okay. Now how do you remember all these things? How do you remember it? Just remember the mnemonic EPIC. Okay, EPICC. What does E over here stands for? E here stands for your external carotid artery. E here stands for your external carotid artery. After external, you have got what? Internal carotid. Okay, E stands for external carotid artery. P stands for pharyngeal plexus. I stands for internal carotid artery. Okay, C, there are two C's. C stands for cardiac branch and C stands for cranial nerves number 2, 3, 4, 6 and 9. EPIC. Okay, next, middle cardiac, that is done. Next, here we have got an artery. Okay, here actually we have got an artery like this. Okay, let me draw it here. Here we have got an artery. The name of this artery is inferior thyroid artery. What is this? Inferior thyroid artery. So what is this plexus doing? I mean, what is the postganglionic fiber doing? This postganglionic fiber will wind up around this inferior thyroid artery like this. Okay, it is forming a plexus around inferior thyroid artery called as inferior thyroid nerve. Next, tell me about the branches of subclavian from the previous lectures. You know that here we have got subclavian artery, right? A branch of subclavian artery coming out from both the sides. What is that? This is called as vertebral artery. You remember that both the vertebral arteries, they meet together in the pontomedullary junction, forming what? Basilar artery, right? Right, whatever it is. So one branch comes all the way like this, right? Now what it is doing? It is winding around what? Your subclavian artery. Not only that, it is also winding around your, what is this? Winding around your vertebral artery. So it is winding around two arteries. One is called as subclavian artery, another artery is called as vertebral artery. It is winding around subclavian artery as well as vertebral artery. Okay, so these are all the branches of the cervical ganglia which you need to remember. Now we shall be discussing regarding the cervical plexus. Okay, so our topic of discussion would be regarding cervical plexus. Now while discussing regarding the cervical plexus, you should know that cervical plexus, it starts from the ventral rami of C1 to C5. Okay, spinal segments, ventral rami of spinal segments C1 to C5. Okay, so cervical plexus is completely having two different types of nerves. There are two different types of nerves here. What are those two different types of nerves? One group is called as cutaneous branches. It gives cutaneous branches. It also gives motor branches, both cutaneous and motor branches. What are the cutaneous branches does it give? You can remember by the mnemonic. Let's go to school. Okay, let's go to school. So you can remember the cutaneous branches in this way. L stands for lesser occipital nerve. L stands for lesser occipital nerve. G stands for greater auricular nerve. Greater auricular nerve. T stands for transverse cervical nerve. Transverse cervical nerve. And S here stands for supraclavicular nerve. Supraclavicular nerve. So lesser occipital nerve, greater auricular nerve, transverse cervical nerve and supraclavicular nerve. So these are the nerves that are cutaneous here. Now when it comes to the motor, you can remember the mnemonic over here, that is map. Okay, how do you go to school? You put the map for the first time and you go to the school. Now M stands for what? M stands for motor. Okay, then what does A stand for? A stand for ansa cervicalis. I will tell you each and everything. What is this? Ansa cervicalis. A stands for ansa cervicalis. Okay, what does P stands for? P stands for phrenic nerve. And there is another type of phrenic nerve called as accessory phrenic nerve. Accessory phrenic nerve. Okay, so here it is motor, ansa cervicalis, phrenic nerve and accessory phrenic nerve. So looking at the root values is very important. For example, lesser occipital nerve, the root value is C2. Okay, next we have got C2, C3 and down here also C2, C3. Okay, next you have got C3, C4. Okay, now when it comes to ansa cervicalis, I will tell you in a minute. Phrenic nerve is C3 to C5 and C5 is accessory phrenic nerve. These are the root values which you have to remember. Now what do you mean by this ansa cervicalis is, as I already told you, these cervical plexus, it starts all the way from C1 to C5. I am just writing down 4 cervical segments, C3 and C4. Okay. Now the ventral ramus of C1, it gives a branch like this. Now this branch goes parallel to a nerve called as a hypoglossal nerve. This nerve is called as hypoglossal nerve. This is your hypoglossal nerve. So this branch goes parallel to the hypoglossal nerve. Along with that, this gives out another branch like this. This branch is called as superior root. What is this? This is called a superior root. Okay. Next, from C2, C3. Okay, from C2 as well as C3 together, it gives out a branch like this, and this branch is called as an inferior root. Okay, so the superior root and inferior root, they join at this particular location, and finally this entire area, whatever circle, whatever is formed, is called as ansa cervicalis. So how is ansa cervicalis formed? It is formed from a nerve that is parallelly going to the hypoglossal nerve, the superior root, right, and the inferior root from C2, C3 together they form the ansa cervicalis. Now from here, what does ansa cervicalis do? Ansa cervicalis basically gives branches, 4 different branches to 4 different muscles. What are those muscles? It gives branches to muscles called as SOS muscles. Okay, what are SOS muscles? Here S here stands for sternohyoid muscle, sternohyoid muscle. Next, another S here stands for sternothyroid muscle, sternothyroid. Then what does O stand for? O stands for omohyoid, and as I told 4, another O also stands for omohyoid. But here in omohyoid we have got two bellies. One is called as a superior belly of omohyoid, another one is called as a inferior belly of omohyoid. So these are the 4 muscles that are supplied by this particular ansa cervicalis. Okay. So other than these 4 muscles, are there any other muscles that are innervated by this entire cervical plexus? Yes. So what are the other muscles that this cervical plexus gives innervation to? So you remember the mnemonic. Let's start the lesson soon. Let's start the lesson soon. So remember this, you went to the school, let's go to the school. How did you go to the school? You kept a map and then you went to the school, and once you go to the school, the lesson will be started soon. Okay. So what does L here stand for? Longus capitis. Muscle is longus capitis, and also Colli muscle, longus capitis and Colli muscle. S stands for sternocleidomastoid muscle, sternocleidomastoid muscle. Okay. T here stands for trapezius muscle. T stands for trapezius. L stands for levator scapulae. And finally S stands for scalene muscles. Okay. So these are all the other muscles that are innervated by overall these cervical plexus. So these are the important things which you need to know regarding the cervical plexus. So now we shall be discussing regarding the ciliary ganglion. Ciliary ganglion. So actually ciliary ganglion is a very short ganglion over here. Nothing much details about this, but pterygopalatine ganglion is very important. So I can draw all these ganglions in a single picture, but it would be very confusing to you. So let us draw the pictures and again and then draw these structures over here. So first important thing is that let us say this is your midbrain. Okay, here you have got your pons, medulla oblongata, and hanging down you have got your spinal cord like this. Okay, and next important thing is this is the face over here, lateral surface, maxilla, mandible. Okay, and let us say this is the eyeball over here. Okay, now what I am telling you is that here I have got a fissure called as supraorbital fissure. Here I have got a fissure called as infraorbital fissure. Okay, so what is this particular fissure over here? This is called as supraorbital fissure, and the lower one is called as infraorbital fissure. Okay. Now where is ciliary ganglion basically located? Ciliary ganglion is basically located in the posterior part of your orbit. See, this is the posterior part of the orbit. This is the place where the ciliary ganglion is located. Okay. So where is it exactly located? Lateral side of optic nerve. Okay. So ciliary ganglion is located posterior portion of your orbit, lateral to optic nerve, okay. Now in the midbrain basically we have got a nucleus. The nucleus which is located in the midbrain is called as Edinger-Westphal nucleus. What is that? Edinger-Westphal nucleus. Okay. Now from this Edinger-Westphal nucleus, these fibers which are coming are called as parasympathetic fibers. These are parasympathetic preganglionic because this is a ciliary ganglion. It did not reach the ciliary ganglion yet. So these are parasympathetic preganglionic fibers. These parasympathetic preganglionic fibers, they enter through the supraorbital fissure and now they enter into your eyeball. Once after entering into the eyeball, this will give two divisions. One is called superior division, one is called as inferior division. okay, and here in the eyeball you have got a muscle here. This muscle is called as inferior oblique muscle. So this inferior division directly goes and supplies your inferior oblique muscle. After supplying that, what will happen is that this inferior division will give a branch now which will enter into the ciliary ganglion. Now from here what is going to happen? From here what will happen is that the post-ganglionic fibers whatever are there, the post-ganglionic ciliary fibers, they go all the way, right? So these post-ganglionic fibers coming out of the ciliary ganglion, this is called as short ciliary nerve. Short ciliary nerve. And what does this short ciliary nerve do? This short ciliary nerve supplies to two important muscles. Okay, so one muscle is called as sphincter pupillae, one muscle is called as sphincter pupillae, okay, that is one muscle, and the other muscle is called as a ciliary muscle. So what is the function of this? This will mainly cause the accommodation. It is responsible for the accommodation as well as the pupillary constriction. So ciliary muscle as well as the sphincter pupillae. So that is supplied by what? The short ciliary nerve. Okay, and these are the things. And by the way, this is your superior division, as I told you. This is your superior division. This is your inferior division. Superior as well as inferior division. Okay, so this is all the important things which you need to know regarding the ciliary ganglion. Very short. Now after ciliary ganglion, the next important ganglion which I will be discussing is pterygopalatine ganglion. Pterygopalatine ganglion. Always remember that this is just a rapid revision session. Okay, we cannot go into much more details because we have less time to clear up all these things. So we shall discuss only those important points. Okay, so when it is coming to when we are discussing about pterygopalatine ganglion, so let me draw the picture over here. This is your midbrain, pons, medulla oblongata. Midbrain, pons and medulla oblongata. And remember, this junction is called as pontomedullary junction. What is this? This is called as your pontomedullary junction. Next important thing is that let me draw the face over here. And remember, this is your maxilla. This is your mandible here. Okay, that is your maxilla and that is your mandible over there. So you have got a bone over here. This is called as a petrous part of your temporal bone. Okay, so let us say, you see this particular bone which I am drawing right now. See, this particular bone over here is called petrous part of your temporal bone. To the petrous part of the temporal bone, you have got a process here. This process is called styloid process. Just beneath the styloid process, you have got an opening. This opening is, behind this opening, you have got a this thing, you have got a bony projection over here. This is called as mastoid process. What is this? Mastoid process. So let me put up all these things over here, little bit, a bit above, that's it. Okay, so let me put up all these things over here a bit above. So this is your mastoid process over here. What is this? Mastoid process. So this is your mastoid process. Mastoid process. And what is the name of this foramen? Stylomastoid foramen. This is your stylomastoid foramen, because this is located between the styloid process and the mastoid. So stylomastoid foramen, and this bone is your petrous part of your temporal bone. Now the first thing I have to just mention over here, that here we have got here, okay, let me draw the orbit as well. Let me draw the orbit as well over here. Okay, now important thing is that here I have got a ganglion. This ganglion is called as trigeminal ganglion. Why this is called trigeminal ganglion? Because this ganglion is going to, from this ganglion, three important nerves are coming out. What are these three important nerves? One is called as V1, right? One is called as V1, one is called as V2, other one is called as V3. What is the first one? Ophthalmic. Next one is called maxillary. Third one is called as mandibular. Okay, now you know this important thing, that here you have got supraorbital fissure and here you have got infraorbital fissure. Okay, Now, next important thing is that you even have got an opening over here. This is called as foramen rotundum. Below here you have got another opening over here. This is called as foramen ovale. Foramen rotundum and foramen ovale. So, what is the second nerve here? This second nerve over here is called as maxillary nerve. Okay, so this maxillary nerve is passing through what? This maxillary nerve is coming out of which foramen over here? Yes. This maxillary nerve is coming out of which foramen? Foramen rotundum. In the same way, you see the last nerve over here. What is this? This is your mandibular nerve. Your mandibular nerve is coming out of which foramen? Yes, this foramen over here is called as foramen ovale. So, how many foramens we have got? Two, rotundum and ovale. From rotundum, that is maxillary nerve exits out. From ovale, your what is this? Mandibular nerve exits out. And the first nerve over here, what is this? Ophthalmic branch. This ophthalmic branch goes all the way and it exits through what? What is this? This is called as your supraorbital fissure. Okay, so it exists through the supraorbital fissure. Now remember one thing, in the eye you have got a gland called as lacrimal gland. What is this gland? This gland over here is called as lacrimal gland. Okay, you know this. Now what I am telling you is that branch of V1 is called lacrimal nerve. See here, this particular lacrimal nerve is going and supplying what? It is supplying your lacrimal gland. And what is the name of this nerve? This nerve over here is called as your lacrimal nerve. Lacrimal nerve. This is supraorbital fissure. Lacrimal nerve. Okay. So till here, let us stop the discussion. Now let us continue drawing some more important structures over here. What is another important structures I want to draw over here is that here, exactly here, you have got a bone, right? You know what is this bone over here with an opening? This bone over here is called as a lateral pterygoid plate. Okay, what is this? This is called as lateral. Okay, let me write this thing down. Yeah, this thing over here is called as lateral pterygoid plate. Lateral pterygoid plate, and lateral pterygoid plate is having an opening, you see, that is called as, what is that opening called as? Pterygoid canal. That opening is called as pterygoid canal. That opening is called pterygoid canal. Just down to this here, just in front of this, behind this, you have got another opening over here. This particular opening here is called as foramen lacerum. Foramen lacerum. So what are the important things you have got? One you have got is the lateral pterygoid plate, I mean the pterygoid canal is present within that, and next you have got the foramen lacerum over here. Now this gap which I am showing it to you, you see this particular gap between the posterior side of the maxilla, all of you know this is your maxilla, yes or no? This is your maxilla. Right, the posterior region of the maxilla as well as the lateral plate of the pterygoid canal, you see this fissure. This is called as what is this fossa? Pterygopalatine fossa. Okay, the fissure here is pterygopalatine fissure, and this is your pterygopalatine fossa. Within this pterygopalatine fossa, okay, let me show it to you. Within this pterygopalatine fossa, you have got a ganglia like this. This ganglia is called as pterygopalatine ganglion. I am just writing this pterygopalatine ganglion as PPG. PPG in the sense pterygopalatine ganglion over here. Right? Now one very important thing is that in the pons region, you have got a nucleus. This nucleus over here is called a superior salivatory nucleus. Superior salivatory nucleus. You know from superior salivatory nucleus, it is a nucleus of which cranial nerve? Cranial nerve number 7. Okay, and in the pontomedullary junction also you have got an opening. This particular foramen in the pontomedullary junction is called as internal auditory meatus. What is this called? IAM, internal auditory meatus. Okay, now what I am telling you is from this opening, you see a nerve that is coming. This is your 7th pair of cranial nerve. Okay. Now this particular 7th pair of cranial nerve comes from your internal acoustic meatus. Right. You see it is coming anteriorly down. right, and suddenly it will turn back, and then it is descending down and comes out of this stylomastoid foramen. Your seventh pair of cranial nerve finally comes out of this stylomastoid foramen. Okay, so this is your seventh pair of cranial nerve. Yeah. Suddenly it is coming out of your stylomastoid foramen. Now this bent part, whatever is there, this bend of the seventh pair of cranial nerve is called as genu. And one of the branch of the seventh pair of cranial nerve is your greater petrosal nerve. Okay. So remember one thing, that a branch of this seventh pair of cranial nerve, the branch of facial nerve is your greater petrosal nerve. Right. So this greater petrosal nerve brings your parasympathetic fibers. Parasympathetic preganglionic, because it has not yet touched the ganglion yet. Right. So it brings the parasympathetic preganglionic fibers, right? It enters down, and by the way, what is the name of this nerve? Just now I told you, what is this? Greater petrosal nerve. This is your greater petrosal nerve. Okay. Now look here. So this greater petrosal nerve comes all the way down. It is coming all the way down, and this greater petrosal nerve, where is it located now? It is located on the top of foramen lacerum. So I just now told you that this is your foramen lacerum. So exactly this nerve is not passing through foramen lacerum, rather this nerve is located on the top of foramen lacerum. Okay. Now next important thing is that I should also discuss that we have got a cervical ganglion called as superior cervical ganglion. This is your superior cervical ganglion. Okay, superior cervical ganglion. Now what this superior cervical ganglion will do? This particular superior cervical ganglion, right? So here you have got common carotid artery dividing into two. This is called as external carotid, and the upper one which is going up is called as internal carotid artery. This is internal carotid artery. Now from this superior cervical ganglion, what is going to happen? Look, from this superior cervical ganglion, the postganglionic fibers, these postganglionic fibers, they start completely forming a plexus, or they start looping around your internal carotid artery. After looping around this internal carotid artery, these postganglionic fibers, right now you call this as which petrosal nerve? Deep petrosal nerve. You call this nerve as deep petrosal nerve. So this deep petrosal nerve, along with what? Along with the greater petrosal nerve, together, deep petrosal nerve and greater petrosal nerve together, what is going to happen? They are going to enter into a canal here. This canal is called as pterygoid canal. Once they enter into the pterygoid canal as a single branch, so I am changing the color to green. So they are entering into the pterygoid canal as a single branch. So once they enter into the pterygoid canal as a single branch, now you call these two nerves together as VDN nerve. Okay, so these two nerves over here together, now you call them as VDN nerve. What is VDN nerve? VDN nerve is both greater petrosal nerve and deep petrosal nerve in the pterygoid canal. Now this particular VDN nerve, what is the fate of this VDN nerve? Now look here, this particular VDN nerve will enter right now into your pterygopalatine ganglion. You see, it is entering into your pterygopalatine ganglion. Once it entered into the pterygopalatine ganglion, what is it going to do? See, first important thing, once it entered into the pterygopalatine ganglion, from here one branch goes all the way, and this branch is coming out of which foramen? Infraorbital fissure. And this branch over here is called as zygomatic branch. What is this branch? Zygomatic branch or zygomatic nerve. So from the pterygopalatine ganglion, the postganglionic fibers, they pass through infraorbital foramen, infraorbital fissure. Why? Because this is supraorbital fissure, this is infraorbital fissure. Okay. Now after this, what is going to happen is that from this zygomatic branch, you see a communicating branch that is going towards the lacrimal nerve. So along with this lacrimal nerve, this communicating branch along with the lacrimal nerve goes and supplies to your lacrimal gland. And what is this branch? This is a communicating branch. Now just behind this pterygopalatine ganglion, you have got a foramen here. This foramen is called as spinopalatine foramen. Okay. What is the name of this foramen? This is called as spinopalatine foramen. Okay. Now what is happening here is that the postganglionic fibers. Okay. So these postganglionic fibers, right? So these postganglionic fibers, they enter through this spinopalatine foramen and they come out as nasopalatine nerve. What is the name of the nerve? This is called as nasopalatine nerve. It comes out as nasopalatine nerve. After that, some of the postganglionic fibers, they come down as a nerve called as greater palatine nerve. Okay, they come out as a nerve called as greater palatine nerve. When I tell greater palatine nerve, there will also be another palatine called as lesser palatine nerve. So from here, another palatine nerve that comes all the way, this is called as lesser palatine nerve. Greater palatine and lesser palatine nerve. Okay, another branch comes, that is called as a pharyngeal branch. So from here only another branch comes here, this is called as your pharyngeal branch. So what are the branches over here? One is called as a greater palatine, another one is called as a lesser palatine, another one is called as a pharyngeal branch. Okay, so all these branches, whatever you can see over here, for example, if you are stimulating this lacrimal nerve, this zygomatic nerve and all, what will happen? Patient will have lacrimation, right? For example, if you are stimulating the branches here, nasopalatine, greater palatine, lesser palatine, all these branches, right? Then what will happen? Patient will have runny nose. Okay. So if, for example, if you are stimulating the lacrimal nerve and all, so what will happen? Lacrimal gland will be stimulated, patient will have watery eyes, right? And next, if you are stimulating nasopalatine, greater palatine and all, what will happen? Patient will have runny nose. Okay. So all these problems will be there with the patients over here. Okay. So that is the reason why you call this pterygopalatine ganglion as ganglion of hay fever. Okay, why do you call it as ganglion of hay fever? Because this will give the symptoms of a hay fever, like for example lacrimation, runny eyes, runny nose and all. So that is why you call this as a ganglion of your hay fever. So this is all the important things which you need to know regarding the pterygopalatine ganglion. So now we shall be discussing regarding the submandibular as well as the otic ganglion. Okay, so we shall discuss both of these ganglions together. So our topic of discussion would be submandibular and otic ganglion. Submandibular and otic ganglion. Okay, now regarding the submandibular as well as otic ganglion, what is the important thing that you need to understand over here? What is the important thing that you need to understand over here? First of all, let us just discuss it fastly, because pterygopalatine ganglion is very important in comparison with the submandibular and otic, and I mean these are also equally important. So we shall not draw those as we have drawn in the pterygopalatine ganglion I have explained you. So I'll just draw the foramens over here. So the first foramen which I'm going to draw over here is your foramen ovale. Okay, this is your foramen ovale. Okay, now through this foramen ovale you see a nerve that is passing. Okay, this is your trigeminal nerve. In trigeminal nerve you have got V1, V2, V3, all of you know. So let us say this is V3. V3 is what? Mandibular, right? Ophthalmic or ophthalmic, maxillary and mandibular. So this is mandibular nerve. So that is mandibular branch of your trigeminal nerve. Now this mandibular branch of trigeminal nerve divides into two divisions like this. Okay, what are these two divisions? One is called as an anterior division, one is called as a posterior division. One is called anterior division, another one is called posterior division. Now this posterior division gives out three branches. So here it is giving 1, 2 and 3. There are three branches that are given by this posterior division. So what are the names of these branches? One branch is called as inferior alveolar nerve. Inferior alveolar nerve. So this is one branch. Next branch is lingual nerve. Next is your lingual nerve, and third is auriculotemporal nerve. Okay, third is auriculotemporal temporal nerve. So what are the three branches? Inferior alveolar nerve, lingual nerve and auriculotemporal nerve. These are the three important branches that are released by this mandibular nerve. Okay. Now let us say you know that lingua is nothing but your tongue. Let us say this is your tongue. So what does this lingual nerve do? Basically this lingual nerve will innervate your tongue over here. Okay. So it will basically innervate the anterior part of the tongue. Now next important thing is that let us say that here we have got seventh pair of cranial nerve. Let us say this this is your seventh pair of cranial nerve, that is your facial nerve. Okay. Now a branch of facial nerve is called as chorda tympani. All of you know. Let us say just side to that we have got a ganglion called as submandibular ganglion. So this particular ganglion over here is your submandibular ganglion. Let me write it down. So this one is your submandibular ganglion. So this is your submandibular ganglion. Now what is happening here is that from this facial nerve you see a nerve that is coming, this is called as chorda tympani. Okay, so this chorda tympani goes along with lingual nerve and then comes down and it will end up in your submandibular ganglion. So now what will happen? From this particular submandibular ganglion, the postganglionic nerves again they go up, pass along the lingual nerve, and just beneath the tongue you have got sublingual gland. Let us say here you have got sublingual gland. So this branch, the postganglionic fibers, they will innervate your sublingual gland, right? So what is happening over here? You see this particular branch is called as chorda tympani. This particular branch is called as chorda tympani. So chorda tympani is a branch of facial nerve. So this is a preganglionic fiber that will end up in your submandibular ganglion. From the submandibular ganglion, the postganglionic fibers, they will go and innervate your sublingual gland. So they will go along with the lingual nerve and innervate your sublingual gland. Okay, and by the way remember one thing, from here there are some more groups of postganglionic fibers, they will also innervate your submandibular gland. Submandibular gland. So you have got two types of glands, sublingual gland as well as submandibular gland. Then who is innervating your parotid gland? Who is innervating parotid gland is that we have to go little to the top. So in the cranial cavity, let us say this is a cranial cavity over here. Here you have got your foramen magnum. Let us say here you have got a foramen called as jugular foramen. Okay. So this is your jugular foramen. We have discussed about the contents previously. Now what I am telling you is that from this particular jugular foramen you see a nerve that is coming out. This is called as your ninth pair of cranial nerve. What is this? This is your ninth pair of cranial nerve, that is your glossopharyngeal nerve. Ninth pair of cranial nerve, that is your glossopharyngeal nerve. Now this ninth pair of cranial nerve or the glossopharyngeal nerve will divide into two branches. Okay. Now one branch is called as tympanic branch. So this branch over here is called as tympanic branch. Okay. What this tympanic branch is going to do? This tympanic branch is going to form a plexus here. Okay. This tympanic branch is going to form a plexus. So the plexus which is formed by this tympanic branch is called as tympanic plexus. Now what will happen with this tympanic plexus is that from this tympanic plexus you see postganglionic fibers. The postganglionic fibers which are running out of this tympanic plexus, they enter this foramen ovale, right? And finally they come all the way like this and they end up in a specific ganglion, and this ganglion where they end up over here is called as otic ganglion. What is this? Otic ganglion. Okay, they end up in a specific ganglion called as otic ganglion. Now what will, okay, let me put up this thing over here itself. So these postganglionic fibers, they will end up in a specific ganglion called as otic ganglion. So this one over here is your otic ganglion. Okay, now let us say that here you have got a gland called as parotid gland. So this one over here is your parotid gland. Parotid gland. So what about this auriculotemporal nerve? Auriculotemporal nerve passes through the parotid gland, but it does not supply the parotid gland. Only it passes through the parotid gland. Then what supplies the parotid gland is that the postganglionic fibers of this otic ganglion. You see the postganglionic fibers of this otic ganglion. These postganglionic fibers, they pass along with the auriculotemporal nerve and supply your parotid gland. What do? They supply your parotid gland. Okay. So the postganglionic fibers, right? The postganglionic fibers from the otic ganglion, they pass along with the auriculotemporal nerve and then they supply the parotid gland. Okay. So you have to know these important branches over here. Okay. So these are some of the very important branches which you need to understand. And now tell me, what is the name of the nerve that is coming out of this tympanic plexus? So out of this tympanic plexus, you see a nerve that is coming and innervating your otic ganglion. So this particular nerve which is coming out of the tympanic plexus is your lesser pectoral nerve, lesser superficial pectoral nerve. Okay. So once again guys, so we have discussed with the foramen ovale. Okay. So from the foramen ovale, you see a nerve that is coming over here. This nerve is called as mandibular nerve. This mandibular nerve gives out two branches. One is called as an anterior branch, another one is called as your posterior branch, right? So this anterior branch gives out three important branches over here. One is called as inferior alveolar, lingual, as well as auriculotemporal. Now coming to the lingual directly will innervate your anterior part of your tongue, right? From the seventh pair of cranial nerve, a branch is coming here. This is called as chorda tympani. Chorda tympani passes along with the lingual nerve and it would relay in the submandibular ganglion. From here, postganglionic fibers go to submandibular ganglion. Postganglionic fibers even go to the sublingual gland. Next here we have got jugular foramen, right? From the jugular foramen, you see the ninth pair of cranial nerve is coming out, dividing into two branches. One is tympanic branch, which forms the tympanic plexus. This is not pectoral nerve, lesser superficial petrosal nerve. Lesser superficial petrosal nerve will innervate your the otic ganglion, will relay in the otic ganglion. From here, the postganglionic fibers, they supply your parotid gland. Okay. And remember, auriculotemporal is not supplying the parotid gland, rather it is passing through the parotid gland. So this is all the discussion you need to know regarding the submandibular as well as the otic ganglion.